again, welcome to all participants for international webinar of Faculty of Nursing, University of Hasanuddin. We're going to start our event soon. Please make sure all of your microphone is in a mute condition. And I remind you once again to rename your name as your real name, because we cannot recognize if you use a different name or your mobile name or device name. Thank you. Okay, I will open this event. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome all of dear participants. We are very delighted to host a very prestigious event to share our experience related to learning and teaching for our School of Nursing during this pandemic situation. Before we start our event, I would like to ask everybody to listen to recital of the Quran that will be presented by Nurul Asfia Sukardi, one of our nursing students from physiotherapy program. For Nurul, if you are already here.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Watlu alaihim naba'a Ibrahim إذ قال لأبيه وقومه ما تعبدون قالوا نعبد أصناما فنظل لها عاكفين قال هل يسمعونكم إذ تدعون أو ينفعونكم أو يضرون قالوا بل وجدنا آباءنا كذلك يفعلون قال أفرأيتم ما كنتم تعبدون صدق الله العظيم. والسلام عليكم ورحمة الله وبركاته.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Nurul. And may Allah Subhanahu wa Ta'ala will reward the reciter and also to all of us who's listening to this. Amin ya Rabbal Alamin. Okay, I just want to inform you before we move to the next schedule that the total number of registered participants who registered to this event is around 3,000, more than 3,000, but unfortunately we cannot put them all in this Zoom meeting, so we have a very tight selection to select all the participants who can join this Zoom meeting, and around 600 consisted of all participants from all of Indonesia, and there are 28 participants from overseas. They are from Saudi Arabia, Malaysia, and Thailand, Philippines, and some of them also from Australia. So this is we are very blessed to have this event, and very happy to see the response from all the participants from all over the places. So for the next schedule, we would like to invite Dr. Ariyanti Saleh for giving opening speech for our event. Dr. Ariyanti Saleh is the Dean of Faculty of Nursing, Universitas Hasanuddin. Please, Ibu Ariyanti, time is yours.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
Bismillahirrahmanirrahim. Good morning, everyone. The Honorable Rector of Universitas Hasanuddin, Prof. Dwia, the Honorable the Dean of Faculty of Medicine, Universitas Hasanuddin, the Dean of Faculty Dentistry, and the Dean of Faculty Pharmacy, the Honorable Vice Dean of Faculty of Nursing, Universitas Hasanuddin, the Head of School of Nursing Program, Nurse Professional Program, and Master of Nursing Program and Physiotherapy Program, the invited foreign and national speakers, the Head of INEC, distinguished guest from PPNI, Head of the Wahidin Sudirohusodo Hospital, and Head of Hasanuddin University Hospital, and special for our wonderful participant, national and overseas participant. And ladies and gentlemen, on behalf of the Nursing Faculty of Hasanuddin University, it is an honor to welcome you to International Webinar, Challenge, Barrier, and Strategy in Delivering Teaching and Learning of the Nursing School during the COVID-19 pandemic. Thank you for participating in the webinar and sharing your knowledge. The students, their parents, and educators around the world are feeling the extraordinary ripple effect of the novel coronavirus as schools are shutting down and quarantine methods are being ordered to cope with the global pandemic, while government and health officials are doing their best slowing down the outbreak. Global education systems are collaborating to collectively respond, provide quality education for all during these difficult times. Our job is to help everyone in providing quality education for all, even in these exceptional times. We must respond decisively, innovatively, and together to suppress the spread of the virus and address the socio-economic devastation that COVID-19 is causing in all regions. The magnitude, the response must match the scale of crisis, that scale, coordinate and comprehensive with the country and international response being guided by the WHO. And it must the multilateral with countries showing solidarity to the most vulnerable communities and nations. The message of the report we are issuing today is clear. The first, shared responsibility and global solidarity in response to the impact of COVID-19. And second, we are the unprecedented situation and the normal rules no longer apply, and we cannot resort the usual tools in such unusual time. It is a call to action. Gratifyingly, the response must be the unique nature, the crisis, and the magnitude of the response must match in scale of our face a common enemy. We are at war with a virus. COVID-19 is killing people, as well attacking the real economy in its core, trade, supply chain, business, and jobs. Entire countries and cities are in lockdown. Borders are closing. Companies are struggling to stay in business, and families are simply struggling to stay afloat. As with all nursing education institutions, to that end, we need solidarity, hope, the political will to see the crisis through together. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you, Ibu Dr. Ariyanti. And we have here already our Rector, Professor Dwia Aries Pulubuhu. Welcome, Prof. So for the next schedule, we would like to ask Prof. Dwia to give speech for this ceremony and also opening the ceremony officially. Please, Prof. Dwia, time is yours.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
And very good morning to all of us. First, I would like to greet our distinguished speakers. Are they here already, all the speakers?
Professor Karen Francis already here, Prof.
Well, okay.
From Australia.
Some of them are
Tasmania,
not.
Yeah, University of Tasmania.
But let me keep to greet them. So, good morning to all distinguished speakers coming from several universities in the world. And for the most, of course, Professor Karen Francis. Ada juga Bapak Sukardi Suba, PhD candidate. And Dr. Janet Yuen-Ha Wong, Dr. Chong Mei, and also Rini Rahmawati, PhD, Dr. Ariyanti, and Dr. Hawa Abdul Aziz. That's all. And of course, I would like to greet the Dean of Faculty of Nursing, on the all vice deans, all the professors, the lecturer, and several deans. I noticed there is a dean from Faculty of Medicine, Prof. Budu, and other deans, and other lecturers from all the university, and of course students and participants. First, of course, we have to thanks to the Almighty of God for the blessing that allowing us to be here to join together in the international webinar held by the Faculty of Nursing of Hasanuddin University, with a very selected topic that I think this is a very strategic one on the theme or topic strategies in delivering and learning at the nursing school during the COVID-19 pandemic. Ladies and gentlemen, I forgot to also extend our gratitude to all distinguished speakers for your time and your information we'll be sharing in here. I think it will be useful and for us to have a very strategic conclusion after all. Ladies and gentlemen, well, during pandemic, lecture and students are entering, I believe, a very highly stressed because need to develop a health system that is facing them in unpredicted challenge. At the same time, of course, we need a very high quality of clinician and also high quality of nurses. So to me, it's very essential to give a better services to the patient during COVID-19. So COVID-19 is a very health crisis situation for us. So therefore, we need to strengthen the nurses' education system in order to prepare or to ensure we have the high quality nurses with a high quality capacity and of course safety in the nurses, in the work, in the hospital, or in the area that they work. So, ladies and gentlemen, to me, crisis can experience or happen at any time. Look back to the several history of the crisis, we can reach various analysis and conclusion that we can learn from the crisis. So during the pandemic COVID-19, we already optimized the online learning, like in Hasanuddin University or Universitas Hasanuddin. All faculties, we maximize to using online learning method. Based on the experience of using the online learning or distant learning, we make sure that to conduct a high quality of learning or high quality of output of the learning for the students, of course. For most important to me, how you can respond and anticipate of clinical cancellation and limitation in face-to-face contact. So, of course, you need the strategy to be developed that the goal of student in learning have to meet with the number of quality experience of complete clinical, laboratory, and simulation component can have to be also meet in the virtual learning. This is very important. So to me, you need to share your experience in the kind to develop the innovative learning by what we call this distant learning or online learning or others name. So ladies and gentlemen, university need to save the world, the better world. University have responsibility to revital the importance, for the better life after COVID or post-COVID or in the era new normal. So we are here in this awards. So we gather here, we discuss here to this purpose. And I believe it will be very meaningful ideas will be developed, and I'm very much, and everyone also very much keen to have the result of this international seminar. So we can entering the new normal with giving a very best quality for learning to the student in the Faculty of Nurse. And at the end, to ensure we will have a very high quality of nurse in serving the patient of pandemic or COVID-19. So ladies and gentlemen, thank you very much for the Faculty of Nursing that your can make this international webinar is experience, and I'm highly appreciate for your what you are doing. And thank you for all participants, and especially to the keynote speaker or the resource persons. And officially, on behalf of the Hasanuddin University, I'm very delighted to state that the international seminar held by Faculty of Nursing of Universitas Hasanuddin with the theme of strategies and delivering teaching and learning at the nursing school during the COVID-19 pandemic will be officially started or opening. Bismillahirrahmanirrahim. Thank you very much. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Prof. Dwia, for the speech and also for opening this ceremony officially. Thank you for your time.
Yeah, and at the same time, I have to apologize. I cannot join until the end of the session, and send my best regards to all speakers, and thank you for Professor Karen Francis and others that already joined since the beginning. Thank you
Yes.
very much.
Thank you very much, Prof. Dia. Understandable.
Terima kasih,
Thank
Prof.
you.
Assalamualaikum.
Waalaikumsalam. All right. Now let's. Since this ceremony has been opened by our Rector, we are going to start with the first speaker. But first, we would like to show you again the schedule for today. The schedule for today. Yes, we will start with first speaker, Professor Karen Francis, and because Professor Karen cannot stay longer than 1 hour, so after Professor Karen deliver her presentation, there will be a discussion session, and then after that we will continue with other panel. Karen, are you here?
Yes, I am.
All right, thank you. How are you, Karen?
I'm very good, thank you, Rainey.
Good.
Thank you for the invitation, and thank you to everyone else that's sitting there listening to what I'm going to say.
Thank you.
I just wanted to start with firstly saying that it's an absolute pleasure to have the opportunity to participate, and I think this is just a wonderful initiative. Well done to you, Renee. I think it's fantastic, and your colleagues that are obviously supporting you in getting this up.
Thank you.
I'd like to acknowledge in our tradition the custodians, the traditional custodians of the land on which I'm sitting and joining in this this meeting. And you can see from my screen at the back, that's just down the road from my home where I live.
Yeah, it's very nice, beautiful.
Yeah, it is, isn't it?
Yeah.
So to start, I decided in speaking with you, I would focus my attention on our undergraduate degree, the Bachelor of Nursing, primarily because our postgraduate program is offered in the online space, and COVID-19 has had very little impact on the delivery of that program. So the registered nurses that undertake it are all in practice. Yeah. And whilst they may have been moved from specialty areas to generalist practice areas as required by their employers, effectively it's had very little impact on that program. Okay. The impact has really been on the undergraduate program.
Yeah. So Karen, before you start, I would like to introduce you to all of our participants. Is that okay?
Yeah, sure.
Yeah. Our first speaker, Professor Karen Francis. She was my wonderful supervisor, very helpful when I did my PhD student and PhD program in Australia. So Professor Karen Francis, she has a lot of huge experiences in nursing education since long time ago. I will not say every position that she has done, but currently she is head of School of Nursing and Associate Dean of New South Wales, and she's in University of Tasmania at the moment. Yeah, so before she was in university, Monash University, Chartered University, moving from university to university, sharing her expertise. But now she's in University of Tasmania. And also probably later on, some of the participants will contact you to, probably they will continue their study in UNHAS. So, yeah. I will give the time to you, Karen, if you can share your, you want to share your own presentation or we share it for you?
I can share mine. I think I'll just...
Yeah, I think it's better. It's better if you can share it so you can control your own presentation.
Yeah. Can you see it?
Not yet.
Okay.
Or we can share it for you.
I'll just try again. It should be sharing. It says it is from this end.
You can try again.
Bisa, Ardian?
Yes, you can try again.
Try it again, Karen. Yep. It's working. Just make it as a slideshow, please.
Okay, slideshow. No.
Yep.
Is that all right, or?
Yeah, that's okay. You can start.
Okay. So as I was saying, I've decided to focus on the Bachelor of Nursing. So at the University of Tasmania, we have a program that with about 2,000 undergrad students enrolled. The program's offered on 3 sites in Tasmania and 1 site in Sydney. So traditionally, or currently, the Bachelor of Nursing is offered really in a traditional face-to-face delivery modality. And we offer in Australia, the nursing programs are generally undergrad programs of 3 years. So our program is 3 years, but we do offer on all the sites except Launceston and the Cradle Coast, which is coming online next year, the program over 2 years. It's still a 3-year program, but it's students hardly get a break during the 2 years, so they finish early, and that's been quite popular. And it's meant that we attract higher calibre students to the Bachelor of Nursing, because really you have to be a really good student to be able to manage the program in that time frame. So the challenges, and none of this will be surprising, with a face-to-face delivery program, with the impact of COVID, the first thing that had to happen, obviously, for everyone's safety was for the program to be moved very quickly, within a week, in fact, fully online. It was, I would say, a fairly significant challenge for staff, many of whom are quite new people from clinical practice to UTAS that have only ever taught really in face-to-face delivery. Although course outlines and some other thing that was one of the other things that was a real issue for us was the IT platform, IT support, and the platforms that were being used at the University of Tasmania were not robust enough to sustain a fully online program, and this obviously applied to all the programs offered by the university. So that was, and again, that had to be changed overnight. So there was an absolute swell of activity that occurred in order to facilitate that and skill people up. The other challenge, I think, for staff, because we'd done a face-to-face delivery program, moving into the online environments meant that teams of people that were teaching the same units all of a sudden had to come together and decide who was delivering what, rather than individuals on the various sites delivering all of the content. So in some ways that was a bonus, I think, for some staff, because technically it probably freed up some time, but not necessarily because of all the work in the background about having to organise and understand how to do synchronous as well as the asynchronous interaction. Another major challenge, which I'm sure everyone's had, in our programs, students start learning nursing skills from the beginning of the program, and obviously their skills become much more sophisticated as they move through the program. The skills are taught in simulated environments within the university, and students then go out into practice throughout the program, where they they participate as a member of staff, although in student status, in a variety of healthcare settings. So, hang on, I've just got, here. Yeah, so what then happened was that we really had to think through how we were going to skill students up without them being able to practice in the simulation spaces, because our campus is all closed. All the simulation spaces were stripped out in order to be thoroughly cleaned, and we are actually only just returning to campus now in small numbers. So what we had to do was the staff had to start making videos and finding other resources to be able to demonstrate online the skills that each of the years students had to become familiar with, so that as soon as we could get them into the sim spaces, or they were able to go into practice, that they would at least understand the principles behind practice and then have an opportunity to refine their skills. I think what we found in this whole process is that staff are able to go home, are able to work from home and still maintain connection with not only the students but their peers. There is a level of concern by the university in general, but I'm sure this is a global concern, that people not being able to go out of their homes and being isolated, as we've had to be and still are in Tasmania, has potentially has a mental health impact. So, we are very mindful of that, and we have regular meetings that we're just calling either a coffee break or, some sort of social interaction with people online to overcome that concern. And with our students as well. There's often, most of the unit coordinators have coffee sessions with students, which is really bring a drink and just have an open discussion. It doesn't have to be about work, or in their case study. It can just be about anything to try and maintain the collegiality, I guess, across the challenges. Some of the other challenges, which again I know have been global, is whilst some of our clinical partners have maintained having students in small numbers, students being able to practice, there's been a real problem with access to personal protective equipment. And we basically have none in our simulation spaces. So one of the first things we've had to do is work really hard to be able to get access to PPE, so that when the students do go into the laboratories, that we have that the equipment. And I think the other thing that we've really had to do was we had to make some decisions as our clinical placement opportunities constricted, that we had to prioritise which students we would send into practice. And so we did that, prioritising students that are completing this year so that they would be ready to enter the workforce as soon as they completed the program. So in June this month, we've got our simulation spaces partially opened. There's been a significant workload impact because we're only allowed to have one academic for 9 students, where we would normally in our sim spaces have one academic to 24 students. So if you extrapolate that out, you can imagine the numbers of repeats of lessons in the sim spaces we have to run in order to accommodate those students. So that's had a fairly significant workload, which means we've had to ask people to do more work or trying to get some casual assistance from people to help us. Anything that we do in terms of having to change the curriculum, which we have had to, so moving it to the online space, and a lot of our assessment items we've had to rethink. We decided that we could not hold examinations, invigilated exams like we have done in the past in this curriculum. So there was a lot of redesigning of the assessment items, and obviously they had to align with the intended learning outcomes. We did move to removing a lot of exams in general, except where we've got quizzes and things that were already in the online environments. And so we've had to really think about how we did that. Because it's a regulated course and because we have to meet the requirements of our regulatory authority, both the University Regulatory Authority, TEXA, and the Australian Nursing Midwifery Accreditation Council, we had to seek approval from both those agencies before we could do anything with the curriculum, which in this pandemic they agreed to without hesitation. So there's been quite a lot of challenges that we've had to face. So some of the barriers that which I've talked to a couple, but I'll just focus specifically on the campus closure. And as I said before, our campuses are technically all still closed, although small numbers by invitation of staff and students are able to go onto campus for very specific activity, and the very specific activity for the School of Nursing is teaching students in the simulation spaces. So that's the only activity we're doing. The other barrier, or barrier might not be quite the word, but certainly a challenge, has, as the pandemic rolled out, the healthcare services, Department of Health at the federal level and at all the state levels, started to put together a surge workforce, which meant that a number of our staff and students who, some of our students are enrolled nurses, which means that they are registered to practice as an enrolled nurse and they work in that capacity. So an enrolled nurse, just for clarification, is like a practical nurse, which I know they have in the States and other parts of the world. They do a 2-year program of study. So these people were health services to accommodate the COVID-19, and so that put some pressure on the School of Nursing. And in terms of students, we had to accommodate any disruption to their study pattern because it was deemed a priority that we support the surge workforce. I've already indicated that access to professional practice experiences, so that's the clinical practice stuff, that was and still is a challenge. There's a lot of the health services, apart from the major tertiary referral hospitals, closed their doors to students across the board, and that was again about safety and protecting the public. The online platform that UNHAS used was a significant problem for us, but we now have something far more robust. So that's been really good actually, because it had to happen and they had a much longer trajectory for improving the infrastructure, so that kind of happened well ahead of plan. Internet access for students and for staff in Tasmania is not necessarily as reliable as it can be, and for a lot of students, we have a lot of students that do our program that come from fairly socio-economically disadvantaged backgrounds, and they may or may not have internet and computing facilities in their homes. So that was another challenge for the university, to be able to provide that at no cost to students and to staff, which they have done. And I guess one of the real challenges and barriers that we have experienced in this whole process has been around students not really understanding what the implications of the COVID pandemic have had and are having on industry, as well as the program and the modality of delivery specifically was, for some students, was something that they really were challenged by. So strategy, so how do we manage this whole process? Well, obviously communication strategy. So that's internal within the university and external, our industry partners, government and specifically our broader community has been really important. We've been really lucky at UNHAS that we have a really good communications or comms team, as they're called, that has helped put together communications that need to go out of the university and to our students, so that being anything we want to say is reviewed before it goes out. I think one of the things that I would say of my colleagues is that I have always known since I've been here that they are very adaptable, and they have absolutely proven to me that they have the capability and the capacity to meet challenges like the pandemics presented with gusto. They really, really, sort of stepped up to the mark and really worked hard to make sure that our students weren't disadvantaged by the changes that we've had to make. Working in partnership, obviously, with our clinical colleagues and stakeholders and with government has been an absolute fundamental strategy that we've employed within the school and across the university to make sure that we are making the contribution we need to make, and at the same time ensuring the integrity of the program of study that our students are undertaking. We've had to make curriculum changes, so content delivery obviously has been a change. The assessment items, which I've already talked to, in terms of making sure they align with the intended learning outcomes. Online quizzes, open book exams, that kind of thing have been new. Not the quizzes, but the open book online exam is definitely something that is a new way of assessing students for my colleagues. The clinical lab has been taught in simulation, which I've already talked to. Interestingly, I think the way we've had, and this goes to part the partnership with clinical partners, students that have been able to go into practice but haven't necessarily completed all the clinical preparation work in the laboratories before they would normally go out, the practice partners have actually stepped up and following our curriculum have been instrumental in preparing students for practice, and they've done, they always assess them in practice, but they've done assessment before students have been allocated to a ward or wherever they might be going in practice, and then supported them all the way through. So I think, you know, that's just been unprecedented additional support. Progression through the program, when students are not actually meeting all the prerequisites, prerequisites, so they may not have completed the clinical aspect of a unit, and technically they should complete that before they can move into the next lot of units of study. So we've had to really do some thinking around that and come up with ways of being able to allow students to move forward, because the last thing we want is for students not to be able to complete their program on time. The clinical practice, instead of students going out in the pre-established schedule, we've are letting students go into practice at whenever opportunities open up, which means that, again, we've been reliant on the clinical staff to help us make sure that students are prepared and able to meet the requirements of whatever the clinical practice unit is that they're undertaking. And adjusting content to reflect the needs of clinical practice and access to the simulation spaces. So that really means about doing a lot of the prep work online with students, and then providing opportunities either as we open the labs, our simulation spaces, to then get into the practice spaces to practice, which is what we're doing at the moment, or as I indicated before, allowing the clinical people to work with them in a preparatory way rather than just in a facilitation manner. So lessons we've learned, I think we've learned some really important lessons. The first one is that the learning and teaching models that have been very stock standard at the University of Tasmania, we can do it differently, and people now appreciate that there are other ways of delivering an undergraduate degree in nursing and still achieve the ILOs, but also I think the preparation of students theoretically and from a practice perspective. I think what this pandemic and the changes we've made has increased cross-campus teaching efficiency and effectiveness, and I also think it's brought together the team in a way that may not have been as collegial as it could have been in the past. And part of that, the reason why it wasn't really was about the tyranny of distance. If you don't see people, then you're less likely to interact with them as you would someone that's in the same vicinity as you are. Staff are agile and able to support, that move. So I've already talked to that one as well. I think as it happens, we are in a re-accreditation phase. Every 5 years, our Bachelor of Nursing programs in Australia have to be completely rewritten and resubmitted to the regulatory authority for approval. We're in that phase now, and our new program due to roll out next year is a flexible learning delivery model with most of the program being delivered online with intensives where students come in and do group work plus practice in the sim spaces. For some of our staff, whilst they understood the reason we were doing that, and that really was responding to feedback that our students wanted much more flexibility, they were hesitant about whether or not that could be, would be as effective as a fully face-to-face program. They now know and understand that it can work, and it can work well. The outdated platforms have been replaced, and that's an absolute fantastic outcome of this whole process. I think what we also understand now is that our staff, that's our academic staff and our professional staff, we should be able to work in a much more flexible way without compromise. And I think that's much better understood now, and that's right throughout the university. And I actually think we've actually improved our connectivity with students, and certainly feedback from students is that they feel much more connected as well to the academic staff and to the university. So I think we've actually achieved quite a lot of positive outcomes from this whole pandemic. So I'm happy to take questions.
Thank you very much, Karen. It's very insightful of what you have done in your school. So I would like to open first from the participants in Zoom room. If anyone wants to ask, you can raise your hand and the committee will let you. Anyone from the participants? Or maybe some of our staff probably would like to ask Prof. Karen?
Yeah.
Bu Rini, you want to ask something?
I think there are some questions from the participants. There are some questions from participants. They sent already, Bu Kusrini.
Yeah, I will read it later. First, I would ask someone from this room first. Anyone? Ardian?
Hello.
Can you see anyone who can ask?
There is 4 participant raise hand. You can see in participant.
I cannot see.
Nasihwan Amiruddin, Edo Lusdiansa, Saldi Yusuf, Sari Kombong.
Hi, mate.
Okay.
They are raised hand.
Good morning.
Yeah.
I'm Prof. Karen, May here. How are you?
I'm very good. Thanks. How are you?
Okay, yeah.
Hey.
Yeah, I agree with Prof. Karen is a very good supervisor. Yeah, she's very supportive even after I graduated from Australia. She still support me until now. My external examiner and so on. Okay, Prof. Karen, I just have one question to have your opinion as regards to practical component. In Malaysia, the nursing board expected the student to achieve 100% practical component despite of this pandemic problem. Okay, so what do you think about it? In terms of pandemic? Can we actually have some discount? I mean, to reduce the percentage of practicum instead of 100%, maybe can reduce to 80% kind of thing. Because in Malaysia, we actually have negotiated with the nursing board. They say no, must be 100%. What do you think about it?
Yeah, we've had exactly the same discussions here, and we've part of our engagement strategy is working obviously with our regulatory authority, and we had a very robust discussion. So when I say we, all the deans of nursing and midwifery across our country have a collective group that meet with the regulatory authority on a regular basis. So that group, and I'm on that executive, we debated whether or not we would argue a case for reduction. What we came to was we only have a minimum of 800 hours that we have to do across 3 years. And a lot of universities have more than the 800 hours, including the University of Tasmania. So what we agreed to was we weren't prepared to compromise the 800 hours, but anyone that had above that wouldn't be penalised if their students only did 800 hours. And part of the thinking behind that was because it's very expensive for students to be placed in clinical practice. Universities are very quick to, if they get an opportunity to say, well, if you can do it in 400 hours, why would we have to pay for 800 hours? And we felt that 800 hours is absolute minimum that we believe that students need in order to go to practice. So, you know, I guess it depends how many hours we're talking about.
Actually, in so many different kind of discipline, even like medicine and so on, I feel like we all nursing is a bit rigid with a lot of things, right? As you say, the lesson learned, we have to live the new normal, right? So there's a lot of interactive like video, kind of a simulation or AI, which can actually integrate into learning, and which is actually good if, let's say, the student keep watching it and keep learning from it. To a certain extent, they learn something, which I think certain procedure like skill, it can be improvised with all this IT. Not necessarily it must be learned 100% from the clinical area, right? So like for medical students, they have a lot of interactive software video, like in terms of assessment for patients. They take into consideration as part of the assessment for them. But I'm not too sure nursing are willing to to practice the same thing as what medical student is doing. Like in my faculty, medical students actually can replace the clinical hour by watching all this video, all those interactive video with health assessment and all that. But in Malaysia, nursing are still not allowed to do so.
No,
Okay.
neither here.
Yeah, maybe that's your last comment. Yeah, please, Karen, and we will let other participants to ask.
Thank you.
Yes. Maybe I can give to Rima Berlian from IKES Prima Nusantara Bukit Tinggi. You can ask your question. Very short and simple question.
Thank you, Ibu Rini. Good morning.
Morning. Yes, please.
Good morning, Mrs. Karen. My name is Rima from West Sumatra. I have a question about campus cross-teaching. Can you explain the detail of campus cross-teaching in University of Tasmania? And how about the barrier? Can you give me advice to find a way to decrease the barrier, like misunderstanding among the students? Thank you, Mrs. Karen, and thank you, Burini.
Yeah. Cross-campus teaching for us means that because we've got the 5 sites all teaching the same unit, and under the current, not the COVID model, but the normal model, we would have 5 sites, five different lecturers or teams teaching the same content to different cohorts of students. In this model, we have the same team of people, but the whole team is teaching the students, so that it's in a synchronous and an asynchronous way. So for me, it means that all the students are getting greater diversity. So they're hearing from different people. So I think they get a wealth of expertise that they don't get just in the traditional face-to-face model. What they have to do, though, as a team is decide who's teaching what, and and they really have to think about, well, how are we going to present the information to students, that kind of thing. So I think it pulls the team together. My thinking is that we've got pots of really expert academic staff, and then we've got other areas where we've got academic staff teaching students. They know something about the content, but you wouldn't say they're an expert in it. Where in this model, we create the opportunity for shared learning of the academic staff as well as for students. And I think the students actually enjoy the diversity of that team of people teaching them, and then coupled with the cafe where they come together and there's just their teaching team plus all the students, it's an opportunity for them to get to know one another. So I think that builds the rapport and enables the the teaching team to know each other better, but also to know all the students.
Yeah. So are you? Yeah. So Rima, I hope you get what you the answer. And I have one. I'm really sorry because of the time. I cannot accept all the questions from this room. We also have this live on YouTube, Karen, and one of the questions from participant and from YouTube from Kusman. Do you still remember? Kusman Ibrahim from UNHAS? Yeah. He would like to ask about how to assess clinical competence for students without going to the clinic, because we, like you said, PAP also is delayed. So how we assess for their competence for these skills, or is there enough only for lab simulation only?
No, I didn't talk about, because I forgot. One of the things that we've also done, and there's a lot of literature that supports this, is particular clinical skills that students need to be able to demonstrate competency for, and there isn't any other opportunities, or maybe it is an opportunity. We've got students doing videoing themselves, and then they provide the video that's then assessed by their academic staff. So that's a strategy. Mm-hmm. I think it's useful at times. I don't know that I think it's the only way and that you would do it, but where you've got no other options, then that's a possibility, I suppose. But what we've done, as I said, is a lot of our clinical sites have actually taken students through, and they always assess them anyway when they're there, but we normally make sure that they're ready to go out. So at this time, that hasn't always been possible.
Okay, so
I think there's a lot of literature now that provides alternatives on how you can assess clinical skills in a non-conventional way.
Yeah, because there are a lot of questions from the participants, because we also take questions before this event started, and majority of them, they're asking about how about the clinical skill competence, because we cannot go to the hospital, and probably, I mean, like some schools in Indonesia, we don't really have advanced lab skills like simulations lab skills. We don't really have it here in Indonesia, so it's kind of like dilemma for us how to make sure students still get the competence. So how about the students who are actually now in the clinical stage? What do they do at the moment? Do you delay them and then do not do anything?
No. What we've been doing is, as clinical placements open, we're trying to get as many of our students through their clinical practice as we can. And so our facilitators that are out in practice are working with them. So they'll go in, instead of starting on Monday, they'll go in before that and have time in the hospital under supervision of a clinical staff member. All our hospitals have some simulation spaces that the staff do their compulsory or mandatory training in. So the students will go there on a one-on-one basis, because one on a couple of people, but we've got to maintain social distancing, the 1.5 metres from one another. Okay. So they will work with the students. We do a lot of scenario training as well as part of the curriculum. So the critical thinking and working through what you will do hasn't changed. Students are always doing that. It's just the actual physically doing a skill or a set of skills that has been a challenge for us. But I think, you know, we've done the very best we can.
Okay. All right. Thank you very much, Karen.
Okay.
Because of the time, we would like to end your session. And thank you very much for all your information and sharing from your school. It will be, it's very, very useful for us to think and rethink again about the curriculum and what we should do in the, especially in the clinical placement. Thank you. Always like if you can stay any longer, but if not, you are, like you said, you cannot stay.
Yeah, no, I've actually got a course advisory meeting. But I'd just like to thank you again for the opportunity and for everyone that's has stayed on and listened. And really, I'm more than happy to talk with you if you want any further information or anything.
Sure. Yes. Thank you very much, Karen.
I wish you
Have a
all
nice
well.
day.
Thank you. Bye.
Bye. All right. So we will move to the second
Thank you, Karen.
panel. Second speaker, Dr. Janet Yuen-Ha Wong from Associate Professor at the School of Nursing, University of Hong Kong. For Janet, time is yours.
Thank you. Thank you.
Yes, present.
So, can you hear me clearly?
Yes, yes, you can hear
Oh,
it
that's
clearly.
good. I'm going to share my screen. Or you would like to introduce me?
Yes, I would like to
Okay.
introduce you first. Our next speaker, Dr. Janet Wong Yuen-Ha. She's Associate Professor from School of Nursing, University of Hong Kong. Next slide. So we can see that she has also huge experiences in nursing, and her current position now is assistant professor in the School of Nursing. She was junior Fulbright visiting scholars in University of Virginia. Oh, that's when you met Rini, yeah?
Right, right.
Okay. Yeah, so Janet, I'll give you maximum 15 minutes for your presentation, and we will not give you questions first after that, because we continue to the next speaker.
Right, okay.
This time is yours.
Thank you, thank you. So I'm going to share my screen. So thank you so much for the invitation, and thank you, Reni, to invite me to talk about it, the online teaching and learning.
You are very welcome, Jen.
Yeah, I miss you.
I miss you too. We talk later.
Right. So it is actually very challenging. I think probably not only Indonesia or Australia, but in Hong Kong and everywhere, teachers are actually learning different kinds of things. We are not very skillful in the online learning at the very beginning, but because of the COVID and because of the students, we need to learn from our own, and we share experiences. And so I particularly think that this kind of like webinar is really excellent because we can actually share our practice among each other. So I'm going to talk about what we did in this 4 months in Hong Kong New School of Nursing. So I think everybody know we have the problems and issue is because of the COVID, and then our nursing students, as what you have mentioned, the nursing students cannot go to the hospital for the clinical practicum, and our class size is actually very big. Is more than 200 students. And especially for the final year students, we are thinking because we really would like them to be graduated on time, and we really want them to join the nursing workforce in Hong Kong and then to serve. So it is really like different kinds of things to balance. all the decisions. And well, in fact, when we are having, when we had the discussion about did we actually negotiate with the nursing council and for reduction of practicum hours. In fact, in Hong Kong, we are actually very lucky. So all the school heads and also the program directors of different Bachelor of Nursing programs, we went together and with the nursing council representative, and then we eventually we reduced a little bit, like a small percentage of clinical practicum, and particularly for just only the final year students. So at the end, some of the institute, they don't really need to do practicum, and or some of them are actually using some kind of different learning activities, especially the simulation, to replace the clinical hours. So that is what we have done in Hong Kong. And for our nursing students, because we are actually very lucky, we have more practicum hours in the junior year students. So that's why we don't really need to like wait for the hospital to reopen for our practicum. However, it doesn't mean that we would like to like stop everything, because the students, they also need to like enhance their clinical skills, and especially the critical thinking, so that they can they will not be their skills will not be actually reduced during this period. So what we did is first of all, we thought about before, when we did the practicum, normally we will have the pre-practicum simulation activities. And what we did is we actually used the mannequin-based simulation. So all these are computerized mannequin. So we use the models from CAE. The female is Apollo, and the male one is the female one is Athena, and the male one is Apollo. So we have been using that kind of mannequin-based simulation. And so you can see our clinical lab, our nursing lab is like the hospital setting. So the students are actually practicing in the simulation lab. And we also use patient-based simulation. So we have some very good people in the community, especially the elderly. They would like to contribute in the teaching. So that's why they came and be the simulator patient. So we set up different kinds of scenarios. We also use interprofessional education. So that's why you can see there are also medical students that are there in the simulation activities. And we realized that we have been using that for almost like 2 years. So we're realizing that the simulation activities can really reduce clinical error and also improve the safety and quality of the healthcare. So we think it is a good way to be delivered. And we also did some kind of like evaluation among our students, including medical and nursing students. And we realized that their teamwork actually, because we used a questionnaire. So we realized that teamwork, critical thinking, and student satisfaction towards the learning is actually increased. So we like to do all this kind of simulation. And we really think that although it is a little bit like labor intensive, and we really need some resources. So like the simulators, all the computerized simulators, they are actually very expensive. But then we also used simulator patients, which is less costly. And it also serves different kinds of like learning skills, especially the communication skills. The standardized patients are actually quite effective. So with all these good feedback from students and also from teachers, so during this COVID period, because we cannot, because of the social distancing, we cannot ask the students come back. And we thought about maybe we can do something like virtual simulation. So virtual simulation is the things that we did this year, mainly because of COVID. Previously, we didn't actually do that. But because of a short period of time, we really need to, if we need to do the virtual simulation, we have to purchase some kind of like software from the market within this very short period of time. But I'm really, I have a sense that probably if time is actually enough and we have the expertise from engineering department in the university, probably we can build our own, but it will be later step. So I'm going to share some of the experiences of using the virtual simulation. So you can see this is the software, and we have been trying to think about different kinds of softwares, and then we finally we picked this one because we think that this is a good program that are following like nursing process with assessment, nursing diagnosis, planning, implementation, and evaluation. So each part students actually need to participate and also need to give some feedback so that we understand their learning, and also they will have the final score at the end. So you can see this is one of the patient, and you can see in the program we have different assessment, and the students actually can in each column, and I mean in each component, they can actually click on it, and then they understand everything about the patient. So one of the things that in this virtual simulation is that they also have the link to something like outside of the program. So when the students, this is a pediatric student, when the students are actually thinking about what is the developmental theory, they can actually click the link and then understand further by using the information from the web. And also, sometimes students, when they do the patient's assessment, sometimes they may not really like remember everything. So this is a good platform to remind them, oh, you have to assess patients in every aspect. So this is also something good for the students to, especially for the revision and then trying to test their knowledge. And so say, for example, if you would like to test the temperature of this patient, you can actually click this, and then you can see some of the problems of the patients here. And the program also have different kinds of equipment that the students can actually use it, and then to test on the patients. And the findings were actually listed on the right hand side. Another good thing is that sometimes when the students, say for example, if the patient is having fever and they need to like make the diagnosis of the patient, they remember, the students actually remember fever, but they didn't actually remember the professional term of hypothermia. So when they put hyper, there will be also some of the different kinds of like diagnosis that you can see, and then the students can pick the best one. It actually reminds the student at the same time about the correct term, instead of if we are doing the simulation in a clinical setting or in the lab setting. Probably the students may forgot what they actually would like to know more about the terms. So it is actually quite interesting to remind them for all the terms. So this is actually the at the end there will be the marks, and the students will know their performance at the end, and we would like. And we also know that if they have completed all the assessment and planning and nursing diagnosis, care plan and evaluation. So these are overall the marks of the students. So Virtual simulation or simulation, any kinds of simulation activity is just a process. What they really learn is basically during debriefing. So online debriefing, we also did that after they play with the game. Play with the scenario. So in the past, we normally do group discussion, but this time we can't. So we use the Zoom to do the online debriefing, because we think that this is really important to recap the students about the learning objectives of the scenario, and we also allow questions from the students at the same time. Chinese students normally they are very shy and they don't really like to speak out. I would say by using the online debriefing through Zoom, in fact, it is better because the students can chat has all the questions in the chat room. The interactions are particularly the interactions during the debriefing is actually better than in the on-site situation. This is a little bit surprising among our teachers. And we use the three-dimensional model of the debriefing. And first of all, we ask the students about their emotion because sometimes students think that, oh, I'm just 50% out of 100. So they have to ventilate a little bit, and then they normally will clarify what they think about the wrong answers. It is actually very crucial, the diffusion phase. And then later on, we also help them to identify what we would like you to learn is what are the things that we really would like you to learn in this scenario. What will be the focus, and what are the learning gaps that you have to follow up. This is the discovery stage. And then later on, we also deepening the students and trying to relate all the things that they have learned in the courses from the simulation scenarios and also the performance. So using the online platform, it is actually something that we are quite surprising because, first of all, as I said, the students, you can see the students here using Zoom. The students actually much more expressive by using the Zoom platform. And for the teachers, we also can use the Zoom to show some of the graphs. This is actually a concept map to trying to illustrate the case scenario. I think this is also very nice. In the past, when we do it in classroom setting, normally we'll just use a whiteboard. But this time when we use the Zoom, we can actually very easy to articulate everything and in a much more efficient way, I would say. We are still running all these virtual simulation, but I would like to mention about that. We are going to also evaluate whether the virtual simulation is really better or is actually as good as the simulation activities on site. So what we are going to do is we actually collected some data after the scenario, and one is the clinical learning environment comparison survey. And the other one is the clinical competency questionnaire. The first one is actually trying to compare from the student's perspective and try to see whether do you think that the virtual simulation is really good and or is really provide them the realistic scenarios. And the second one is a clinical competency questionnaire. First of all, we will do it pre-test and post-test. So we will ask them to fill up the questionnaire first, and then to do the virtual simulation, and then later on we will also compare at the post-test. So we are still doing the data collection. I hope we'll be able to have another chance to share the information in the nursing world by using the literature. And so what we have been learned in this virtual simulation, we realized that the clinical scenarios can still maintain some kind of realism. and also have a very high level of interaction between students and also teachers. And the students can really like being accessible anytime and anywhere, and you can provide the instant feedback containing different kinds of rationales, and we can also like further modify as a game maybe later on to enhance the enjoyment. And we surprisingly, we also realized that virtual simulation can solve some of the problems in mannequin and patient-based simulation. Like the virtual simulation, we can allow more students to do it at the same time. And then we don't really need to like run repeated sections for the for the on-site simulation. We normally run a repeated section because of the big class. And we also don't really need to like consider the availability of the simulation activities and also the scheduling of the students, the timetabling. So it is actually something good by using the virtual simulation. And what we are going to do is, in the next step, we are going to think about whether the virtual simulation can be used as the gamification, and we are also trying to think about whether we can develop like telehealth, especially for the postgraduate students, because the clinical practitioner, the nursing practitioner, probably they will need to like assess patients. So telehealth mode will be another way to let the students learn better, especially the questioning skills. So this is something that we are going to do more. So thank you so much for your attention, and I welcome questions later on.
All right, thank you very much, Janet. Very interesting presentation, and you know what? We are very envy of your simulation lab and also the application. I'm sure many participants will ask about that later on. Thank you, Janet.
Thank you.
And I will move. I'm sorry, before maybe in the schedule supposed to be Sukardi, but it's okay. Now we would like to ask Sukardi Suba to continue with his session. Sukardi? All right, so Sukardi Suba, he's a PhD candidate. At the moment, he's studying at Sukardi. Actually, she was our students before, one of our students, very diligent and smart student, and he continued his study in the USA for his master's degree, and also right now, currently, he's doing his PhD at University of California, yeah? Is that correct? Yep. Yeah. Okay. Mm-hmm. So Sukardi, without any further delay, I would like to give you time to your presentation. If you could make it kind of like 10 minutes, that would be great.
Okay.
All right, thanks.
Can you see my screen?
Yes, we can.
Okay, great. Pertama-tama terima kasih buat kesempatan untuk sharing, and hopefully this could be an insightful presentation. And I think what I'm going to emphasize is more on the didactic portion of educational learning in the US, because I've been serving as a teaching assistant for a master's program and not really involved in the clinical rotations. But I'm just going to start with the current situations in San Francisco in terms of the COVID-19. San Francisco has been doing fairly well, I would say, so far in terms of containing the infection rate, considering that San Francisco is the second most dense populated city in the US. And so far, as of May 29th, we only had 2,500 total case, and with 41 total death compared to New York City, that's roughly like almost half of the 100,000 people who died from the COVID-19. And so how are colleges and universities adapting to the COVID-19 pandemic? First of all, prior to the COVID-19 outbreak, actually, many schools already had hybrid format in terms of like how they deliver teaching and learning. For the students, meaning that schools already had in-person class meetings regularly. That's the primary learning method, but also utilizing learning management systems, using online platform to enhance student learning experiences. And then when the COVID-19 hit the US, it changed everything because, you know, a lot of universities, Stanford and University of Washington were the first university that closed its campus early in March, followed by a large majority of higher institutions, including UCSF in second March 2020. And so right now, all classrooms already moved completely online until further notice, especially for UCSF right now. The graduate division just decided early this week that we will still use online learning method until fall quarter, and probably will determine later on how we're going to move forward for early 2021. Some universities I know will start reopening and will do hybrid sessions, like University of Pittsburgh. But even then, they still limit the amount of classroom that they're gonna open. But primarily, it will be still on online learning. Learning approaches during COVID-19 pandemic. I will start with the didactic learning approaches, and then I will talk a little bit later about the clinical learning process. There's few approaches implemented during the COVID-19 right now, and I think as the previous speakers already mentioned, virtual meeting is the most common approach right now in the US, and this could be a two-way format where faculty interchangeably with teachers. So student and faculty can have interaction directly through the platform, but I would suggest that this is much more ideal for small group sessions, just because it's really hard to maintain and lead the discussion if there are more than 20 students in the Zoom. And like what we do right now, we can also do it as a webinar where it's only the faculty as the primary speaker throughout the entire meeting, and student can just ask questions through the Q&A box. Faculty has the option to allow students to ask questions, and I believe many of us are already familiar with this kind of platforms, but so far we've been just using Zoom. WebEx for some restricted institutions like the VA hospitals usually will just use WebEx, mainly because they're a security concern. And also want to highlight that it's also important to, like if you conduct a Zoom meeting, I think it's also important to record the meeting and save it for later, for that students can revisit the video, can relearn again what's being presented on their own pace. And then in terms of learning management system, I just found out that UNHAS already has this type of platform. And so I think it's great. And this is, I think, you know, it's really enhancing student learning experience, just because it's much more flexible, and faculty or teachers can, you know, tweak something in there and added some options for, like, you know, adding more videos or adding more additional resources for students to learn. And for students, they can learn, especially, you know, class materials on their own pace. And, you know, generally, there are lots of features or tools that can help the learning processes. And I think what's most common practice here is that faculty will make their pre-recorded lectures and upload it in the platforms. And that's easier because then students can just visit the platform anytime they want. But also there's a student discussion board that can be a useful tool for students to share their critical thinking and show how they discuss on a certain topic or case scenarios. We use Moodle site in UCSF, and there are also lots of others. Canvas, Stanford uses Canvas as well. I've never used Blackboard, but Moodle is fairly easy to use, and there's a demo version and there's actually a free version that you can use if you want to use it individually, the same as Canvas. So I think you can check it out. Virtual office hours, I think this is something that was not widely implemented, at least in a few years back when I was still a student in UNHAS. But I think office hours provide additional space and opportunities for students and faculty to discuss concerns regarding class materials, and also to explore ideas, to explore students' ideas. Sometimes there's no time left after regular class meetings, after the Zoom meetings, and so office hours is the best way to make up for that limited time. And you know, office hours, you could definitely just schedule it as a drop-in session. So usually what we do is we already have materials in our Moodle site, and then we already have specific weekly meetings, Zoom meetings, and we share the meeting ID with the students and say, we are available during this time. You can drop in any time between 1 p.m. to 2 p.m. and you can ask any questions during that time. So that's like on top of the materials that they're already learning through the online platform. Additional learning tool, you know, a lot of us here are using Camtasia, but Camtasia is a video recording software. So usually faculty will make their own slides and kind of like pretending they're presenting to their students, but actually recording their screens and their voices. So, and then after that, they would upload this slide, the presentations video in the platform. Although Camtasia is quite pricey, so, and I just found out there's this open broadcaster software, which is free. And so you can definitely try that on. Zoom also has a feature where you can record it, and actually it's free, and it will convert your recording and it can be served as lecture videos. Cloud services, we've been using Box for students to submit their assignments, and also for students, especially if they're working in group assignments. Usually they can use Google Docs so that they can edit and changes whatever assignments simultaneously, and they can share their documents with the faculty as well. I think challenges, Professor Karen Francis already kind of touched base on this as well. I mean, in the US, even in the US, we sometimes have connectivity issues. So that's why a lot of faculty would prefer to have their pre-recorded lectures already submitted in the platform, because that's just easier. Honor of code, I think this is an important part, because it's really just to make sure the integrity of each student whenever they submit something, that those are their own work. What about clinical skills? So we do have Camber simulation lab, but unfortunately this lab is closed right now, and there have been discussions about reopening, but even right now they're still measuring the square footage of the room, how many people can fit in at one time. But I think it's not going to be happening until probably early August or so. And so, you know, direct clinical skills lab are not possible right now. In terms of students who need to complete the clinical hours requirement, fortunately, some hospitals and clinics are still accepting students to do their clinical rotations. In cases where they could not find clinical placements, unfortunately, there's nothing much the school could do. So we are given options whether the student can take leave of absence during this time, and then wait until later in the fall so that they can complete the hours. But still, it is the responsibility of the schools to find students clinical placement. So I think we have the same challenges as what Professor Francis described before. Options in terms of virtual simulations, and I'm glad that Dr. Wong mentioned this earlier. So I found these resources online. There are a lot of virtual simulations that actually we can use. And majority of these resources are free, and I believe these slides are shared with the participants, so you can check it out. But there are some clinical specialties that you can do through these simulations, and it's great because then students can really implement what they've learning didactically and practice, even though it's virtual, but still, you know, it's kind of like a makeup session from missing the in-person clinical skills lab. In terms of student evaluations, so far what we've been doing here at UCSF is combining several of these approaches. So we already have online assignments through the platforms, final exam. Because of we're moving the learning process to online, we cannot do proctored exam anymore. So it's all open book. And then also we do have faculty usually develop individualized case studies where students would learn the case and they would provide their brief essay in terms of what they would do in those clinical scenarios. Some or few faculty, especially in certain specialty, would use oral examinations as well for like small number of students as a group, and this could be like a direct case scenarios reading, like the faculty will present a case and then students will react directly in that meeting. Online discussion board is one way, and also I think it was Professor Karen who mentioned student also could do simulation video on their own. So they are asked to, like, you know, these are like specific skills that you need to learn, and you know, whoever in your house could do it with you, then if that would be great if they can provide the simulation lab. And
sorry, Kadri, your time, maybe 2 or 3 more minutes.
Yes, almost
okay,
there.
Thanks.
This is my last slide. So I think I would emphasize that institutions should acknowledge that we are now in a state where certain learning processes are impossible. So, and I'm glad Professor Karen as well earlier already mentioned that there should be a coordination between the schools of nursing and the regulatory board in terms of how they should you know, what would be the best way to adjust the curriculum, especially one issue that we experienced lately was that students are asking whether they could change the grading process, the grading method from letter grade ABC to fail to satisfactory or unsatisfactory, which is, those are two different thing, because the way for how it meets the board of registered nursing is totally different, and so there has to be a continued discussion between the institutions and you know, we have Majelis Tenaga Kerja Indonesia or whoever is in the position to say these are the requirements. Unfortunately, for those who have to meet clinical hours rotation, they have to. There's no negotiation on that. For nurse practitioner programs and clinical nurse specialists here, they are required to complete 5 and 50 hours of practice. And so right now, graduate divisions allow students to still fulfill that requirement like 2 weeks after the official end of spring term, which is great. But you know, unfortunately, it's one thing that the institution should consider how to better work on that clinical rotation hours. I think that's all I have. Thank you so much.
All right, thank you very much, Sukardi. It's very interesting presentation, especially about the simulation link that you have already shared, which is very useful, and probably we just hope that there's the simulation thing in Bahasa Indonesia, yeah? I mean, like our people develop that one because, you know, the language here and everything. Yeah. All right, so our next speaker is Dr. Chong Mei Chan. She is also my beloved friend. We have a very happy time together in Gippsland campus with Karen. Yeah. Dr. Chong right now, she's the head of Department of Nursing Science in Faculty of Medicine, University of Malaya. She's area of interest in pediatric health and family health, and she will share her experience in Faculty of Nursing School in Faculty of Medicine, University of Malaya. Please, May, time is yours.
Very good morning, selamat pagi and salam sejahtera to all. Thank you very much for inviting me to share my experience, my humble experience as compared to the earlier presentation. Right, more or less we share quite similar experience. Right? So I would like to share with you the Malaysian perspective. Okay. So all of us know this COVID pandemic is actually give us a very mega malefficient in the 21st century. Yeah. So not only in the daily life, right, but also it affected the educations very much. Okay. Almost all the school and university has been shut down. Yeah. For this change of transmissions. However, education still need to carry on. Life still have to go on. To carry on with the educations. Yeah, online pedagogy is starting to flourish. It's becoming new normal. Online or digital teaching is a viable alternative to conventional face-to-face teaching and learning. Actually, when listening to the previous speaker and also the experience from Indonesia, actually online learning is not something new. All of us have implemented hybrid learning or blended learning. We have been using Moodle, we have used LMS in teaching. But however, in nursing practice, we are not only relying on that because the clinical skill is very important. Clinical practice is very important. Whereby hands-on still the most important thing that we need to capture, right? So for Malaysia, this is my content online. In University of Malaysia, yeah, in line with the Prime Minister official statement regarding the extensions of movement control order, or you call it lockdown, yeah, to 14 April 2020, the university has determined as follows. We have made changes to the whole university management structure, right? We have actually have modified the academic calendar. Yeah, we start teaching when the lockdown started in 18 March. Everything was shut down. Yeah, even online learning was not allowed. Yeah. Until 26 April, we resume our teaching and learning via online. That is for theory sessions. Then online teaching and learning, I will mention this again later. Alternative assessment method and final examination. And in terms of grade I means progressive, especially like those students, they feel that they cannot cope with online, or they feel that they have a lot of obstacles to carry on with online learning. They might want to withdraw, yeah. So they can carry on with progressive, meaning that the credit hour will be carried on to the next semester, right? Until face-to-face learning resume, and especially for practicum, yeah. Most of my student practicum will be put under the grade I, the progressive condition. Then oral viva was implemented, yeah, across the campus. Submission of PG research work is also can be done online, and course and teaching evaluation. We used to have C test, and we call it course and teaching evaluation every year. But because of the new method of teaching, we move it to online. So for this year, the university have decided not to have course and teaching evaluation done for the lecturer and the student. So industrial training and teaching practicum, teaching practice, especially for those teaching needs to go on field work, has been postponed for time being. So how was my university come up with this new structure? Is actually based on the regulatory body instruction, right? Our setting is not so fortunate as compared to the previous presenter. Basically, you just receive an order from maybe from the nursing board or from the university order, right? For our setting, we have to follow the instruction by Ministry of Health, Ministry of Higher Education, and then the Malaysia Quality Assurance and the security unit, right? So if let's say three ministries say yes, you can carry on with whatever, but the other ones say no, you have to stop it. And basically, the instruction coming to us we cannot confirm our whatever planning that we have done, because every 2 weeks, according to the MCO, if MCO not lifted, there's another new regulation coming in. So it is just like a share market. Yeah, every day we have to look at the circular and adapt to whatever changes we need. So in terms of online teaching approaches, we use most of the things have mentioned by previous speaker, right? We use Zoom or Google Meet to do the online streaming with the student, okay? And then we also have LMS by using Moodle, right? So this LMS Moodle, we have been using it even before the pandemic, okay? And we will upload all the PowerPoint as scheduled, and then some of the PowerPoint we actually, so before the pandemic, the PowerPoint is just a supplementary beside the face-to-face learning. But when we have started fully online, most of the PowerPoint will have a voiceover, yeah, for the student. And you also use Microsoft 365, yeah, whereby we use Teams to integrate our teaching. And each course we will have one group, yeah, of teaching, and we also integrate, as what you have mentioned earlier, the video, interactive video, video with scenario, video with procedure, so integrated in all these subgroup, right? So students can actually access it. So each group, only the student assigned to the group will have the access to this, right? So and students can actually do their assignment within the team, Microsoft document team, so they can actually edit the assignment in group. So we have been using this for our teaching, and as we know, there will be problem. Yeah, if we are using full online streaming and we are using Spectrum fully because of internet connectivity. So knowing this problem, we actually have other support. Right, so the students say I cannot access Spectrum because internet connectivity poor. Then students say I cannot go into Zoom because I have not enough data to run the Zoom. Okay, so do they have the excuse? They don't have excuse. You can't access Zoom. Then you have other thing. Yeah, we have actually support with Facebook, with departmental Facebook. We have a Telegram to give information to students, and then we also have UN app. Yeah, UNHAS, where the student can access a lot of information from teaching learning. And then we also have a WhatsApp group. The WhatsApp group we actually we created for every cohort. Every cohort will have one group, and then each individual subject we also have one group. So the student have no way they can escape and then say, oh, I cannot access this and that. So there are many ways of capture them and give them support. So in terms of assessment, we focus on continuous assessment. Right, and we are trying. We actually have not reached the assessment yet. The assessment will be started end of June, right? So we are trying to do online synchronized and asynchronized open book examination, reflective writing, and perhaps we may consider YY if the student will have problem. Okay, so before the real exam, we are going to plan for a mock exam for the student to try and see any hiccup or any problem that we need to overcome. So I really envy with the previous speaker, right? So most are even in Tasmania, in Hong Kong, or in US, they have actually started their practicum, even though with restriction with the new normal. But unfortunately for my student, we are not supposed to have practicum until next year, right? The government say no, right? So students are not supposed to go back to campus to avoid any transmissions of the student or student get infected. So only the final year are allowed. So I only have one group of students final year, but luckily my number of students are not like in Hong Kong or Indonesia. I only have 10 students for my final year. Okay, so it doesn't give me a lot of problem. So so they will be coming back in 1st July, but however, there are a lot of restrictions, even in the hostel, right? They have to follow the SOP. Each room is supposed to have only one student, and they are not supposed to interact with anybody when they are in the hostel. They should be locked themselves in the hostel. So I'm quite worried if this is going to go very long time. I'm afraid my students all will get depression and need psychiatric treatment, right? Because you cannot be with yourself. But however, we can't help it because to avoid any infection transmission, right? So and then each ward they are only allowed 5 students per ward, okay? And the department have to provide PPE because the hospital may be short of PPE, so we need to provide PPE for them. And then when they are coming back, since I cannot put so many students there, I will improvise with doing the practical in the simulation ward. Of course, my simulation ward will not be like the Hong Kong University, right? So we will try our very best. We make it like what do you call that? A sample ward, a simulator ward, right? So each cubicle will have a designated different scenario. Like maybe one scenario for orthopedic, the other one is community health. And in the simulator ward, there is also a lot of SOP to follow, right? Each bed only allowed 2 students. So the 2 students will be assigned to that particular bed for the whole day of practical session. And then they are not supposed to communicate with the other student from other bed or other ward. Okay, so and then all students need to check the temperature before they come in, and they have to wear all the PPE before they enter the ward. So after one session of practicum completed, the whole ward have to wipe up with sanitation before we accept another group of students, right? So we also trying to come up with a video simulator for the student. Though we don't have, but because of pandemic, that's why whatever happened, there are opportunity there. So we grab the opportunity to demand the faculty to actually purchase some of the useful video for our students to use. So of course, whatever good thing that happen, there will be challenge and barrier. Okay, my challenge and barrier in University of Malaya for my nursing student is quite similar to the earlier speaker. Number one is the internet connection, right? To my surprise, even in US, they have internet connection problem. What more about we in Asia country, right? So internet connection usually happen to students who are from rural area or the indigenous place, okay, whereby they have poor connectivity and environment factors. Because when you are in home environment, especially for those who have a lot of siblings at home, it can be very noisy for them to study. And then they also complain they may not have a privacy to do the exam online, right? Of course, doing online study, it needs a lot of self-discipline and motivation, right? Sometimes students complain to you, they have poor internet connectivity. There might be genuine complaint, but some other students, all the while they don't have problem, suddenly they have problem. Maybe they don't have good self-discipline, and then they blame on the internet connectivity. So that can happen to the student, right? So we really need to monitor how the student learn. So the challenge and barrier not only happen to student, it happen to lecturer as well. Though I say we already have experience doing blended learning, but that blended learning is more, the LMA is more on supporting the face-to-face learning. right? So when we started have to learn live streaming and all that, that's the time we learn how to use Zoom, we learn how to use Google Meet, we learn how to use a lot of things, right? Even the lecturer have to go for workshop to learn all these things, right? Okay, so how do we overcome this problem, yeah, in order to achieve the learning outcome, right? So in terms of teaching, maybe we should not use live streaming for too long, perhaps maybe for half an hour and supported with PowerPoint, with voiceover, or use low bandwidth teaching. You might even use mobile, WhatsApp, yeah, to upload file or to upload any video using mobile. So easier for students to actually access to it, right? And then using mobile social media, as I mentioned earlier, focus more on asynchronous method with little support of synchronous, as what Dr. Sukardi had mentioned just now. Use pre-recorded voice-over slide rather than live streaming. Encourage discussion among students using mobile, or at the LMS, they can actually use forum to discuss any issue. Okay, I have finished my presentation. Perhaps whatever that we faced here during the pandemic, yeah, actually there is a very good lesson for us to learn, right? So despite of ignoring the advantages of LMS and Moodle, we used to have it, we used to do, right? We actually have to cherish, yeah, with all these advantages that given to us, all these facility given to us, we really have to make use to it, yeah, in line to face the new normal, right? And this is a good opportunity, especially for those who don't have advanced technology like Hong Kong University. We can demand our faculty, right, to actually think about having investment in all this, right, in order to give a better learning environment for the student. And it also can actually reduce the time in the practicum area. And we also have to open the eye of the whatever regulatory body, especially the nursing board. High time we have to move from our comfort zone. Yeah, we have to move from a comfort zone to a more modern world of teaching. Yeah, modern way of teaching by using AI, by using ICT, right? So let us voice this out to whatever authority that we can actually invest in that. Yeah, thank you very much.
Yes, thank you, May. It's a very impressive PowerPoint. I think like probably we have similar situation regarding like internet connection and excuses from the students that they cannot join the Zoom and everything. Yeah, we have a similar situation. So I will remind again to all participants that we still have 3 more speakers, so please bear with us because all the informations or all the experiences that we'll get from these another 3 speakers will be very, might be useful for us later in our school. So there will be one from our university, from UNHAS, and one from Universitas Gadjah Mada in Jogja, and one from School of Nursing in King Abdul Aziz in Jeddah. So I will let our next speaker, Dr. Rini Rahmawati. She's currently now a Vice Dean of Academic and Research and Innovative, I think. She will correct me later. I'm not really sure because we changed the name of the, but mostly to the Academic
Research and Innovation.
Yes, Vice Dean of our Academic Research and Innovation. Dr. Rini already also has so many experiences in nursing education, and she will share experiences from our university. Please, Ibu Rini, hi.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you so much for the opportunity. First of all, I would like to say thank you to all the guest speakers, keynote speakers, the audience that already attended this international webinar. And then also to my best friend, Janet, thank you so much. You can join with us now. So regarding the topic that we're going to share about the challenges, barriers, and strategies in delivering online teaching and learning in our faculty of Nursing, Universitas Hasanuddin. So all of these pictures are coming from our students who also work as COVID-19 nurses in some hospitals in Makassar, and that's also our classroom, which we really miss this class, but we cannot go there now due to the pandemic, and then we will explain about all the situations that we experience now. So this is kind of overview that I will explain in my presentation. So maybe this is same for all of us from Indonesia, but I would like to explain to those who coming from overseas that this is our situation right now, that as you can see here, the number of the COVID-19 patients positive, recovered, and also died due to the COVID-19 outbreak, it can be seen in this slide. And then this is our city. Okay, this is Sulawesi Selatan province, and then the capital city of South Sulawesi province is Makassar. And this is the situation right now. As you can see also the number of, we have 3 categories. I don't think I need to explain here because it takes time. So actually we just can focus also for the number of patients of COVID-19. And this is, we call it as the patients under supervision. And these are people under monitoring. So this is a kind of a situation. And what about the response of Universitas Hasanuddin, especially our rector, when we have to work from home since March 15, 2020, when at that time our president asked and required for all of us to work from home. And then this is the decree that, as we can see here, that we cannot conduct any clinical labs. We cannot allow to go to the hospitals to conduct clinical internship. And also the main point here also, we cannot welcoming our international students. For your information, in Faculty of Nursing, we also have inbound and outbound students. Inbound students, when the pandemic hit us, they were coming from Hanze University, the Netherlands. And at that time, they were practicing in the hospital and also in our school, but then we have to send them home because this is the regulation from their government and also from our government. So it impacts the academic mobility in our faculty, in our school. And then also, this is also hit us, maybe also all of you in other universities in Indonesia, that there is no graduation, and all over the world it happened. And what is the response from our dean regarding this decree from the rector, that we still do the clinical skill lab, but only for, the clinical placement, the clinical internship, but only for enhancing the critical thinking and the procedural knowledge, but not for psychomotor or something else regarding to, for example, like how to administer the intravenous catheter and so on. So we limit, it's only for knowledge for during the pandemic outbreak. This is our school, for those who already visit our school, and for those who never, welcome to Faculty of Nursing, UNHAS. It's empty like this, also happen in other universities. And as we can see here, because there is the outbreak, what happened, the teaching strategies change. So before we are doing blended learning, face-to-face, e-learning, and self-study, and then we have to change the mode. And now we have to do fully online learning and teaching, even though there are some types again of fully online and teaching. When it happened to the teaching strategies, the student assessment also, we need to modify. And then when we need to change all of this, what is the impact? The students. Students got affected of this kind of situation. Teachers also, administrative staff got impacted. And also the learning resources, we have to provide many resources that at the beginning, maybe it's quite difficult for us to deliver all things online. And the main point also to support this is the facility, because maybe actually I envy those who are from established universities. Janet, you are very blessed to be there because you can easily to get, not easily, I know that you are the chair of the learning and teaching model or design. It's very established, well established, and here we are in the growing and then we are developing this kind of model. So the impact, it's not only here, but also goes to affect our learning outcomes. Maybe the program learning outcomes, the intended learning outcomes, and also the course learning outcomes. And this change our monitoring and evaluation. Before it's easy just to submit and then it's fine, but now we have to think we have to send the screenshot and everything. It's too complicated. So it changed also maybe our curriculum. Why? Because at the end I will show you, it's about how we achieve the intended learning outcomes. We cannot fully achieve the intended learning outcomes, so we need to adjust this curriculum. And then, of course, at the end, we will try to modify our course module and syllabus. So let us hear what our students, our lecturers, and also our supporting staff feels about it.
Impact of COVID-19 pandemic on nursing education at Faculty of Nursing, Universitas Hasanuddin, Indonesia.
Very challenging.
Too complicated.
Efficient but confused.
Making diverse learning methods.
Student attention.
Well prepared.
Clinical skill lab reschedule.
Internet access is not good.
Poor connection.
Time management.
Online data collection.
Good preparations.
Quiet, confusing.
Less effective.
Difficult to stay focused.
Internet connection problem.
No clinical exposure.
Time management.
Recording lectures.
Monitoring evaluasi.
Melakukan penyesuaian.
So those are the experiences of our students, faculty, and then also our supporting staff, because it hits us and then we have to change everything. It's only maybe 1 week to adjust to all changes. And this is because before the COVID-19 pandemic, we all over Indonesia, we did almost the same teaching strategies. And then afterwards, we can assess them based on what we taught them, and then this kind of evaluations or assessment that we did before the pandemic. But now, what happened during the pandemic? For the bachelor degree, for example, we have 3 types of online. One is the fully synchronous mode, which is it's easy for us because it's face-to-face, the benefits, and then also we can direct supervision for the students. And then we can talk with them just like in the classroom, but it's using the platform. But of course, like what they said before, it's very expensive. And then even though our school we bought the Zoom license, but still students, everybody needs to have their internet. And then also the fully asynchronous mode, this is the one that we prefer to choose, just like what some previous keynote speakers told, that we need to prepare all, because when we choose the first one, we can just give what we want to say to our students. But when we conducted the second one, the fully asynchronous, so we have to teach using PowerPoint. We know now that we can record our voice through the PowerPoint, and then afterwards we go to upload it maybe in YouTube because it's easy and it's getting smaller the size, and then we upload it again to our platform in the university, so students can easily to access without using many quota. And then we can use it for the clinical skill lab. And the combination is just something that sometimes we use Zoom just to check their attendance, and then afterwards we conduct another asynchronous mode. And what about the clinical internship or the professional nurse stage? This is quite difficult, not quite, actually it's very difficult. So using the fully synchronous mode, we only do for those who we will give some information to improve their critical thinking and procedural knowledge. But we also can use it for the case-based seminar or discussion. This is what we did in our nursing management stage, because I'm also the coordinator. So we try to keep doing this professional nurse, but by obtaining data using online questionnaires. So we still do and try to analyze all cases happen related to COVID-19 and non-COVID-19, and we try to manage it, but it's based on the data from the hospitals. And thanks God, we got this permission from the hospital to do that. And then for the fully asynchronous mode in the clinical stage that we can use is for reflective study. And then also for, like I said before, the online data collection, we can also use the asynchronous. So it's not real time, but you can do it later. And then the platforms that we need to do, this is the Zoom license. It's, of course, we need budget for it. So for the school that want to use it, it's good. It's not like basic 40 minutes and you have to leave it, or it's disconnected in 40 minutes, but it's very good because it's unlimited meeting minutes. And then, but it's there is a quota for not more than 300 participants, I guess. And then the G Suite Google Meet, this is the one also that we have to pay for it. And then, but it's good because it's up to 300 participants and it's unlimited meeting minutes. And M.Si, that's our platform in UNHAS and other things that I think you are familiar with it. And this is what we do. Because before, as we heard from the previous keynote speakers, they have very sophisticated labs and then sophisticated platforms. But what we have now, we try to optimize what we have. Because what we have now is Zoom license, so we try to optimize. We can teach with the statistics. I agree with you, Janet, that because we can draw and have everything using the annotation and everything, and we can use it also for the small group discussion, because this is what we did. We can use breakout classroom. So it's like the real situation, but that's synchronous. So remember, internet quota. And then the other fully synchronous, what I said, is Google Meet. This is the one that from G Suite Google Meet. I also use it, and then it's unlimited meeting minutes. It's very useful, but Zoom is better than this one. I'm not the marketing, but I'm the customer. So, and then the next one is about the fully asynchronous mode. This is what we have in UNHAS, Sekolah. Sekolah is a system kelola pembelajaran, but also I think that's in Bugis, also in Makassaris we say sekolah. Jadi, so this is Sekolah, and this is very helpful. We try to optimize this one. So we use this to teach students. For example, for anatomy, we can use it also for student assessment, not only teaching, but also for student assessment. We can use all the features that it has. For example, like to make the question based on the nursing competencies. And sorry, I forgot to tell you, because we can also use it for the question analysis, not item analysis, but question analysis. At least it's good for us to develop our portfolio for each course. This is the fully asynchronous I explained before. This is the CSL, Clinical Skill Lab Simulation videos. Luckily, we have some videos that we have about the procedure, so we can show this to the students first, and then after that they can just know it, because this is critical thinking, and we just explain more about the things that how to by discussion. And then for the student assessment, I think we all have the same problems about this. So in our school, for the BSN degree program, fully synchronous, we use it for written and oral tests. So for those who will use it, I mean, it's okay, but regardless the quota, but most of us using the fully asynchronous. So we use case study, analytic paper, and then also combination about that. And for the clinical internship, we still can use SOCA because it's a subjective oral, so we can use synchronous because we cannot use asynchronous. We need to see them, we need to discuss with them, we need to give feedback, so it's good using the synchronous. And then for async, we just use it for the case-based literature reviews. We keep doing our clinical placement, but it's focusing on case-based literature reviews. And these are the
3 more minutes, Nurini.
Okay. Sekolah, Google Forms, and so on. So what happened to our intended learning outcomes, achieve or not, telling the truth, after we made some evaluation, because it's the end of the semester. So we can achieve just the knowledge part, and partial for attitudes, because we can give them some questions in the multiple MCQ based on the vignette. But for the competence, we cannot achieve for the internet learning outcome. So what we did, we decided to reschedule. And luckily, I listened from Prof. Karen, so it's good to invite them again. Maybe only we try to limit the numbers of the students after the situation is getting better, and then we will reschedule for the competence, because we try to achieve the internet learning outcomes. So at the end, thank you so much for the university and the faculty, because in this situation, we are in Indonesia is, of course, is different. So we got credit earns for our students. The rector gave the decree that we can give them credits for those who active or involved in the COVID-19 pandemic, to reduce the numbers and to provide care for the patients. And then also for the financial support from the faculty, also university provide internet quota for them, and then for the teachers and also for the supporting staff. And they also provide the logistic only for students who lives in campus area. And the last, of course, all schools also did the same thing. We did donation for all of them that got impact from the pandemic COVID-19. We miss this place. We hope that the pandemic will end soon, and then we can see all of you, and we will welcome you all to our university. Thank you so much. Wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Rini. And your video remind us to our campus. It's been a long time not attending the campus. We miss it. All right. So without further delay, we would like to invite Dr. Ariyanti from UGM. Dr. Ariyanti is head of undergraduate program at School of Nursing in Faculty of Medicine, Public Health and Nursing in Universitas Gadjah Mada. And without further delay, we would like to invite Dr. Yani to share her experience from UGM.
Okay, good morning everyone. Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera untuk kita semua. Thank you for the moderator and also for all the speaker for your sharing. Also, thank you for the participant for joining this webinar. I am Ariyanti. I am currently head of undergraduate program of nursing, Faculty of Medicine, Public Health and Nursing, Universitas Gadjah Mada. I think this is all of one already know where is our institution. It's located in Yogyakarta Special Province, west part of Indonesia, and this is the gate of our university. And School of Nursing belongs of Faculty of Medicine, Public Health and Nursing, and this is our building. And this is only briefly introduce our institution. We already graduate 1,932 students, and we have already got AUN certification and also national accreditation with A predicate. And also our students have 100% pass national exam. And we have already have a collaboration network within country or with other country, almost the countries in other continent. And this is, I think, the situation in UGM not similar with previous speakers. In UNHAS, and this is my presentation first with three term: dynamic, flexible, freedom in learning. We decide the strategies based on some policies, national policies, university and faculty policies. We decide maximal study from home since 17 March this year, and we developed some strategies, online learning strategies during pandemic COVID-19. I think this is also similar with UNHAS experience, we combine synchronous and asynchronous method, and also flexibility lecturer to choose synchronous and asynchronous platform. We don't decide we must use Webex or Zoom only, but yeah, lecturer can choose based on their preference. And also because this is the the pandemic situation even though before we already implement blended learning, but the percentage is still low. So to overcome the barrier when the lecturer to online learning, we provide online learning guidebook. And also we establishing help desk team. Help desk team, this is a team. This team to help lecturer that have difficulty when they run online learning guidebook, especially for senior lecturer. And also we encourage for the coordinator course coordinator to minimize student assignment. Similar with UNHAS, we also postpone hands-on on practicum and internship based in the hospital. And this is, I think this is also similar LMS, Learning Management System. We have ELISA, ELOC, and also GAMEL. And we combine, as I mentioned before, we combine asynchronous and also synchronous method. The lecturer put PPT, record PPT, billing video, quiz, guideline into the LMS, Moodle, and put this materi belajar and also link external and guideline everything before the lecturer running online discussion. They put into the LMS, and then the lecturer conducted the online discussion to because the student before already learn about the material that the lecturer will give. So for online discussion, for example, if in the conventional class fully 100 minutes, so for the online discussion, it is not necessary conduct in 100 minutes. And for the student thesis, because data collection in clinical field is not is not allowed by hospitals. So if the student have thesis, the data collection of thesis conducted in hospital is temporarily postponed. And we suggest the student, if possible, do data collection using web-based collection, for example, using Google Form. And we still conducted thesis defense using online system. And we also encourage for students, especially a student for the in the final year of their study, did the student thesis using secondary data, because our faculty using have HDSS, health demography surveillance system. So we encourage the students to do their thesis using the secondary data. And also we also allowed our students use literature review for their thesis. And how about the assessment? For the assessment, we still conducted the assessment through online assessment. This assessment to measure knowledge using multiple choice, and we using ELISA to do the online assessment. And online assessment is we can say that tricky because there is some issue when we did online assessment. For example, technical assessment, poor connection, and maybe of electricity when did online assessment. So the issue of how to say the student will cheating maybe. So we develop a team facilitator to how to guide the online assessment. So before the real time of online assessment, we did trial time, to make sure that students have good understanding to do online assessment and to anticipate what kind of the problem that we that may rise when we do online assessment, so we can anticipate strategy to overcome. So we also put the integrity declared in the system. So we put a positive thinking to students that they will not cheating doing online assessment. We also time time management. So limit the time to the online assessment. So it is how to say to limit the risk of to cheat among a student. And for the internship phase, our profession there is a method shifting. I think this is also similar. So we put the cognitive competence first using online case discussion, evidence-based practice seminar, skill motor skills. We hope we can do this psychomotor skill for our student. And also we put strategy schedule around shifting. We put the community nursing practice round first, and then the student will do a clinical nursing practice. Fortunately, we have opportunity to send our students become a COVID-19 volunteer, did education, advocacy, and online assistance. And we reward their contribution as 7 credits. And this is the flyer of the community nursing practice that student can be can participate, become volunteer. And how the student practice perspective in online learning evaluation, we can say for the from this picture that students perceive that they in terms of teacher-student interaction, they feel very good and good. So there is no barrier in teacher-student interaction using online learning. And also access of online learning, especially when they access ELISA, is very good and good. However, there is some limitation. For example, from this picture, students feel that they experience financial hardship. As a UNHAS experience, we also give internet quota support for the student. And how about the lecturer perspective? The lecturer said that there is some most patient experience. They feel flexibility and efficiency and convenience because they not they didn't need to be hurry to go to campus. So they feel flexibility and also efficiency. And also the students feel that the rest schedule during online learning is minimal compared with before. And also for the future, I think this is the good point that the lecturer feel mostly feel confident also, but majority also strongly confident to do to continue online learning after pandemic. The university have policy that we must implement blended learning 10% and 30%, but we still conducted less than 10%. So this kind of a positive aspect of pandemic, in the future, we can increase the percentage of blended learning because the lecturer strongly confident. And also some lecturer give recommendation. For example, they propose various online learning method. Because this is how to say, we not prepare well. We didn't implement various online learning method. So in the future, maybe this is our homework that we must do a training for the lecturer to do various in terms of various online learning method, and also internet data support for student and lecturer. We already for student, but not give for the lecturer. And also, they also recommend there is training for supporting staff, administration staff, to help to organize the online learning process. And also, they give recommendation to add a license platform. We already we already have a license platform like Zoom and Webex that they need more. I think this is my final presentation, and you can visit us in YouTube, Instagram, email, and website. Thank you.
All right, thank you very much, Dr. Yani. And we would like to move into the last but not least, our speaker.
Hello, good morning, how are you?
Oh, hi, how are you? It's next to noon time here, maybe early morning in your country.
Yeah, it's extremely early morning.
I can hear your voice.
I'm doing my best to make it like sounds normal. I'll try to share my...
Yeah, it's fine, it's understandable. So our next speaker is Dr. Hawa Al-Abdulaziz. She's one of also my colleague from Monash University when we did our PhD program together. We had a great time working in a very small room.
Yes.
Now she's in the head of Maternity and Children Department, Faculty of Nursing, King Abdulaziz University, and her expertise is pediatric health. Without further delay, I'll give you time, Hawa. If you can make it in 10 minutes, that will be great.
I think I can do it in less than 10 minutes.
All right, because so many questions.
Yeah.
All right, please.
Good morning, everyone. My name is Hawa Abdulaziz from King Abdulaziz University in Saudi Arabia. As you told me that I'm going to be the last speaker, so you make it easy for me because everyone is going to talk about everything that we're gonna share it, because this pandemic shows us that everyone in the same situation, experiencing the same difficulties, and we are struggling in the same boat. So I tried just to focus on the things that I thought others might not consider talking about it. So I'm going to go straight away about some of the barriers that we face it at the beginning. So once we have this announcement for holding the students at home, no one coming to the campus, no professors, no students. So it's like someone built a huge wall in front of us. So we start thinking about how we get access to our students. Although we claiming during the last years before that we are using the distant education, we are using the technology, we are doing everything, but in fact, we discovered that we were not utilizing it very well. So the first barrier we face it related to students, related to our staff, related to our all academic and administrators, how to get access, how to be familiarized with our students, how to be familiar in this situation that we are staying at home and working from home. We discovered that some staff, they have limited resources. They don't have PCs at home. So one of the things that it was like a huge barrier for the staff, how they're gonna continue. One of the like few professors in my department, they don't have the PCs at home. They don't have audiovisual materials. So how are they gonna use their computer, laptop? They have no connection. For me, when I tried my first lecture at the office, I tried just to use my regular headphones. I'm using iPhone. My PC is totally not talking to my connections. So I'm looking for someone who's using Android to have like the headphones to use it. So it's really few things or small things that became a barrier for us. Also, the internet connection. Most of the people or of the academic, they are basing or using finishing their work, using their PCs in the office, in the campus, and where we have the strong internet connections. For the students as well, they have the very good connection at the campus. But some of our students living in rural area, they don't have these good connections. And also we have the issue of having multiple and large classes. So some of the classes we have around 150 students, and we have things in the system that divided the students into groups. So we have like, in the system, we have like fourth year students in 4 groups. Actually, in the reality, we put them in one large classroom to deliver the lecture. But once it's become into distant education, we have to do it as a separate 4 classes. So how for the professor to conduct 4 lectures in the same time for the 4 groups? So it was one of the barriers that we faced at the beginning. What we did in the faculty or at the university level, that we started immediately from the moment that announcement delivered to us that students are not coming to campus, we started with the basic things that we have. For example, we just started with the PowerPoint, voice over PowerPoint. Just we asked the lecturer to explain everything, to deliver the lecture, and to record it, and that's the basic thing that they can do it, and send the PowerPoint or the whole file to the students so they will not miss the lecture, and we will not interrupt our schedule, because it's not something that we can solve it in a week or 2. We were aware that the thing's going to be for a long time. So we started with the facilities, with the things that we have it. So that's the main barriers that we start with it, or we face it and experience. Then we came to the challenge. We have staff who are seniors. We have staff who are juniors. For the junior staff, they are okay with using internet facilities, using the new platforms, everything. It's a piece of cake for them. But what about our professors who are not familiar with this technology? So it was one of the challenges that we faced, how to make them familiar with using any kind of communication media that or system that we're going to use it to deliver the teaching. Also, we have some of the staff, they are not having previous experience of working. We have the education system in our university, the Blackboard system. So some of the staff, they didn't use it before. They didn't attend any workshop about using it. So it was one of the challenges that we need to deal with it. For the students, we know that students, suddenly they are required to attend all the lecture at home, to study at home, to be with the families, to take care of their kids, their own kids, and doing everything at home. So how we can make sure their commitment? We know that even when they are coming to the campus, sometimes they are coming late. We have like restricted policies about attending after establishing the lecture. So we have too many things to be done. So how we make sure that these students will have this commitment? How we make sure that these students are going just to enter the class and leave the computer and go to sleep? And then they said, we attended the class. So how are we going to make sure? How can we maintain the interactive environment? So these things was our challenge on administrative level, on academic level, and on students level. So the strategies we started from the first moment. The faculty announced that everyone should attend workshops organized by the faculty. So all the staff required to attend how to deal with and how to use the Blackboard system, to use it for teaching. We use it before, and I can say personally I use it like 2 or 3 years ago to do my exams, to establish a connection with the students. We have discussion with the students, but to say I use it effectively 100%, no. And some staff, they didn't use it at all. And we were begging them, please activate the Blackboard system. They just go and put the announcement and they leave. They just put the teaching materials and they leave. But now, under the situation that we have been, they have to use it properly. So we organized a workshop for the staff so we can empower them, we can teach them how to use it properly, and created webinars from professionals in the university to teach us how to use every single tool in the Blackboard, how to use it for assessment, how to use it for evaluation, how to use it for teaching, and how to use it to communicate with the students. And the university did their best to offer some of the PCs for the academic or for the professors who doesn't have their own PCs at home, especially for the seniors or for the non-Saudis or who are coming from overseas. So it's hard to ask them to buy computers at that time. So the faculty offers some of the machines to them. For students, also we start to communicate, each professor, each department communicating with the students. They have to build commitment. They are not coming to the faculty, but they are not in the holiday. We deliver the message clearly to them that we are in a situation that's enforced to us. So it's not under our option or our choice, but they have no choice except to study and to continue their work at home. The faculty organize academic advising sessions for the students and for the faculties and the professors. The students were like shocked suddenly, especially for the graduates. They were so concerned about their marks, about their level, how they're gonna do the exams. They try to contact the academic in everywhere, through emails, through the team leaders, through WhatsApp, through the Twitter. They are so worried. So the faculty decided to conduct an academic advising session for the students, just to calm them down, to deliver the message to them that we are aware about the situation, we are in their side, we are doing our best to support them, to make everything smooth, and to maintain their level and to grant their getting the maximum of this experience. Our staff also, we noticed that they were like overstressed. Suddenly they were required to know everything about dealing with this electronic system. They are required to change in their teaching style. They are required to change in their assessment method. Even they are required to change in the content and many things. So beside their families' responsibilities, beside their kids who suffering from the problem as a students, so we organize an academic advising sessions for them to just keep them in the same page with everyone, and supporting them, and still giving them the advice that they can still allocate time for work. It's not like they mentioned in the first 2 weeks or the first month that they are working 24 hours, not like when they are in campus. Also, some of the students, they didn't have PCs, and we discovered some technical issues when using the iPad and tablets and these machines. So whoever was in severe need, or they can't offer their own PCs, or someone's at home, the university offer a few PCs for the students so they can use it to study and to do their exams. So regarding the learning, as we know in nursing, we have the theoretical part, we have the laboratory part, and we have the clinical practice. Clinical, it's stopped in the hospitals. Our students are no longer can go to do their training. We have a very nice, a huge simulation center in the hospital, but unfortunately also we couldn't have access to go to get access to these mannequins, to work in the simulation centers. So for theoretical part, all lectures converted to virtual classes, and the lectures delivered using PowerPoint and group discussion and presentation. And alhamdulillah, we can say that 100% we are satisfied with the theoretical part. Regarding the laboratory, those procedures, some of them, for example, in maternity, we have like a specialized procedure. A student, they didn't do pap smear before, some of the vaginal examination, some of the delivery process, all these things, how we gonna deliver it to the students. So the professors, regarding the theoretical part of the laboratory content, they explain it very well using the PowerPoint and virtual classes. And for the practical part, they used like, for some procedure, they recorded their own video and uploaded to the student. So the teaching staff, they went to the lab, they recorded, they did the procedure from A to Z and uploaded to the student to see it. Or some of the procedures, like the delivery and the other things, they get like educational videos, they get registered in recognized bodies who have like education videos, and they get permission to upload some of the videos, and they upload it to the students and discuss every point with the student to make it clear for them. Regarding the clinical practice, even if I said we are satisfied with what we achieved now, but still we didn't we didn't achieve the things that should be done. So clinical means student, they have to have hands-on clinic, hands-on practice. So what our professors did is creating scenarios, showing videos of the hospitals, for example, antenatal, postnatal labor, or pediatric sections. So they simulated, our professors simulated as a patients. Students were asking them about the things that they used to ask in the history, taking the notes from them, writing their complete nursing care plan, and they give them like a scenarios for discussion, doing critical thinking, and writing their feedback.
Some of 3 more minutes.
Okay. And some of the psychomotor things, we inshallah assure that our students going to cover it during their internship, because all these things are going to be repeated during the intern program. Assessment method, all assessments have been done through the Blackboard online. We changed the assessment to be like short answers, discussion, presentations, case study. All our OSCE exams regarding the practical things changed to be OSCE exams. All assessment method has been changed to be aligned with our teaching methods. And also the grade distribution has been changed based on the rules, based on the policies delivered to us from the Ministry of Health, that Ministry of Higher Education, I mean, that we have to redistribute the grades, so making more of the grades or the weight for the during year or semester work, and leave less marks for the final exam. So that's what we have done to just make sure that students' level will not be affected. The main priority or the main concept we considered during our pandemic period teaching our students is to achieving our learning outcomes with the maximum level that we can attain. And alhamdulillah, with all efforts done from everyone, through professors, through admin, through students, alhamdulillah, we are almost achieving our required learning outcomes. as we scheduled or as we required by the quality and quality assurance department. Alhamdulillah, we went through it very well. We finished our exams. I think you are not yet in the process of examination, but for us, alhamdulillah, at the end of Ramadan, we finished our exams. Students get their results, alhamdulillah, with the variation of the grade distribution and with the change of the assessment method, and all these things help students to maintain their level, or some of students obtain a higher mark than their expectation, which alhamdulillah consider it as satisfied. So that's all what I can say about how we went through our pandemic COVID-19 during teaching last semester. And inshallah, you and whoever not yet finishing their semester, inshallah, you're gonna pass it very well.
All right. Thank you very much, Hawa, for your sharing your experience from your school. And to all participants, I hope you're still there. This is actually one of the barrier, I think, or the challenges for conducting online learning and teaching, because we don't know whether the students, they're just still sitting there or listening or maybe going anywhere, or I don't know. But I mean, like, that's the challenges that all of us are facing. And some of the questions also already been explained by the speaker about how to achieve the learning outcome. And to tell you the truth, I'm very confused with all of the questions. Like, we have probably 40 questions. And I'm really sorry if I don't read every questions, but we try to summary or grouping the questions, similar questions, into one question that hope will answer all of your questions. So it doesn't matter, it doesn't mean that if we don't read your questions and then we ignore you, but we read all of the questions, but we cannot read all of them. So first, I would like to give opportunity to participant here from Zoom. You can raise your hand, and committee will give a chance for you to ask. I have one from Nurun Lasara from Angriana, and I will have only three questions first from the audience. So Nurun, Angriana, and one more. There's anyone raise hand? If you want to ask, raise your hand first. Okay, while we're waiting, please, Nurun, you can ask your question. And Rijal from physiotherapy.
Okay, thank you.
Please, Nurun, you can ask who do you want to ask to.
Okay, are you hear me?
Yes.
Okay, thank you very much, Ibu Kusrini, as a moderator in this international.
Beneran, yeah.
Yeah.
Please forward your questions to or to anyone.
Okay. Thank you very much. First of all, I will thank you for all the speaker. It's very great and very interesting. And my question is, the first is for Prof. Janet and Prof. Janet and Karen, and also Dr. Chong, maybe, because in your presentation, I'm not here about the time limitation of the lecture. If the lecture or practical is using unsynchronous, for example, when we practice in hospital in the synchronous, we need 3 weeks. And how about if the student practical on unsynchronous? Is it we still need the time 3 weeks, or we have to change maybe for the shorter, or maybe we can still on the time as a synchronous time? Okay, this is the first question. And the second is maybe for Dr. Chong from Malaysia. You say that the practical will carry out in the next semester. Okay, if you carry out the practical in next semester, how you can manage the time. Is it the student can practical in the next semester the same time, or the student will need the longer time if they practical in next semester? Okay, and the third is to Dr. Janet from, Dr. Janet, from Hong Kong. Can you tell me about the pre and post test for before the simulation? Because honestly, that in my institution we didn't using the pre and post test. Maybe you can share your information about the pre and post test.
Okay.
Thank you very much.
Thank you, Bu Nurul.
Yeah. Okay.
So we will just collect all the questions first, and then later on we can answer it all together. So maybe for Janet and May, maybe Nurul's questions is regarding to, like in Indonesia we have 16 meetings for one subject. So with this online distance learning using asynchronous mode, are we still have to like 16 meeting, or we can modify it or something like that? Maybe I just clarified for that. All the questions are clear, yeah?
It's actually the last questions.
But for May or for Janet?
It's okay.
For you.
You answer first. It's okay. Janet, you go first.
No. We will answer it later. I will just collect the questions first.
Oh.
Yeah. Okay. So Angriana, you can ask your question. Angriana.
Okay. Can you see? I can get the video on.
Wow, you are in the hospital with your full complete.
Hi, thank you so much for the opportunity. Just simple question. How about the clinical skill for the students? As all the speaker has explained about a synchronized mode method, I think it's very good. But how to guarantee that the student get the best how to guarantee that the student that the student can communicable to the lecturer, how to avoid some kind like a lazy student that just see or hear the Zoominar, that they can more attractive, how to motivate the student. Maybe all the lecture has to think about this academic this advice empowerment for the student, how to guarantee that they can communicable, they can attractable to their,
motivate them to still learning through the online learning system.
Their physical thing of the student, to support the student.
All right.
Thank you very much.
So this is for all the speakers, yeah? So the questions is probably more into what's the strategies that we can use to increase students' motivations in, like in learning, in the online learning situation, because sometimes, like, we don't know whether they're there or not, or they do their task. Because like in the class, sometimes we can control them, but in the virtual world, we cannot really control them. I think that's pretty much. So Rijal from physiotherapy program from UNHAS. Pak Rijal? Yes.
Okay.
Yeah. Please introduce yourself and the questions to whom?
Okay, thank you for the moderator.
Your voice, can you make it louder, please?
Thank you for the moderator for the chance. My name is Rijal, one of the lecturer of physiotherapy at nursing faculty, Hasanuddin University. And actually, I want to ask to Sukardi Suba related to how he evaluated the student, especially for the clinical practice. And he said that they apply something like the individual projects. And he tried to ask to the student to make something like simulation video and one-page essay. So my questions is, first, how do you give feedback or make sure that students have done in simulation video, which is really in good procedure? How do you make sure that the process? And the second one is about the one-page essay. Do you mean that the one-page essay which is related with their videos, or another topic from the clinical skills? So I think that is my questions. Thank you.
All right. Thank you, Rijal. I think this is all also issues for us. I mean, like our concern on how to make sure students can achieve the competence regarding the clinical skill. Because like we know we can fulfill it through online distance with knowledge competence, but not with the skills. That's why maybe the situation here for Janet or other speakers, that our conditions is we are still quite confused how to fulfill the skill competence, which is many questions related to that one as well through group chat at Zoom. So maybe if you can answer probably from Janet. And also Janet, I would like to add a questions for you regarding your software, the RX software, the one that you explained before. There's a questions asking about, are we creating our own case study using this software, or what kind of application of software do you recommend for this one? Is this application free to use, or we have to pay for that?
Yeah. So shall I answer the question?
Yeah.
Oh, okay.
You can answer it first.
So first of all, thank you so much for all your very attentive for all your attention, and the questions are all good. And so first of all, the DXL, there are actually, when we purchase it, there are actually some of the case scenarios installed in the system. However, in the second stage, because we are just using it for a very short period of time, so in the second phase, we are actually discussing with the vendor to develop some more case scenarios, because we realize that some of the case scenarios, they are actually creating from the Western countries, and it's may not be really very local and culturally adaptive.
Yeah.
So that's why in the second stage, we are planning to actually help them to put more content in, especially for the Chinese population. So that's why they will be able to applicable to everybody. And I have a sense that Chinese population is actually quite similar. I mean, the culture is quite similar to the South Asia country. So especially we would like to say, for example, put more things related to relatives, say for example, because normally we are very concerned about our relatives if our relatives are actually family members admitted to the hospital. So these are something that we would like to add. And so in terms of
is that free, the application? I mean, can we access it?
It is actually not free, unfortunately. However, I realize that it is actually a good platform, but I would say it is not really a very difficult platform that will be able to be created by maybe a simplified platform. From the people from the engineering department. I'm pretty sure it will be able to do so. So by using the collaboration with others, probably we'll be able to do so. and you may also add your own like features. So I think it is possible.
Yeah, that can be a challenge for us. Yeah, to do more. Next project is to develop the application, similar application that you use over there.
Yeah. In the very we are very lucky. We have some resources from the school, and however, I think it is actually the principles are theirs, and with the collaboration with others, I'm pretty sure the technology is not really like nursing discipline, but engineering department. In fact, some of our projects like the VR project, the virtual reality, we are actually working collaboratively with the Department of Engineering. So it is possible, and so this is something that that for the DXL. And for the skill competency, I'm totally agree with the audience that for the skills, it is impossible to be like test through online platform. So what we did is that that online platform basically is for training up students' cognitive functioning, critical thinking, and problem solving skills. So we are training their brain. We just don't want to really let them to just stay at home without anything to do. So that's why we put that in that way. But in fact, we also organized the on-site assessment. So Hong Kong is currently, the situation is better. So we actually allowed some of the students coming back for the examination. It is like total patient care examinations. So trying to care for 1 to 2 patients at the same time. So we are doing these kind of simulation activities with the assessment on site. So we cannot assess the skill competency through the online platform. And another question that I remember is about how to motivate the students. This is really quite difficult. I think probably every all the countries, even though we are having the online learning, the teachers are very hardworking. We are learning the new things. However, the students, some of them, we don't know. They just register and then they are going into the platform and then going somewhere else.
Exactly.
And sometimes it is actually quite difficult. It really depends on which type of classes. If we are talking about lectures, we didn't actually ask all the students to show their face. We didn't, because it is actually quite difficult for one teacher to monitor 200 students in a lecture. But for the tutorial or small group activities, we also use the Zoom for the small group. We use breakout room and also separate different groups, different Zoom link for the small group activities. And for that kind of activities, we actually ask students to show their face. And if they think that it is actually not very nice for the background, we will use the virtual background, like what I'm using. So probably that will be better, because showing the face, it will actually help them to be much more focused. But another way is to use some of the exercise that they have to hand in, and or some of the marks that in the course that they really require to attend the classes and then do something. So unfortunately, we have to use that kind of way, but I don't know what other method will be able to use it.
About the students who enter the big classroom, are you attendance? How about their attendance? Is that their registers, or how do you?
Right. So the Zoom, in fact, our university purchased the license. So we actually ask every student to log in through our Hong Kong U portal way. So we will be able to capture all the email address through the Zoom.
Okay,
So
who register on that day? Yeah, all right. That's really good. Yeah.
Yeah.
So probably May also you wanna answer the question?
I will just reinforce what Janet had been saying. In terms of attendance, we use the Moodle LMS. So we will QR code there. So every lesson we will have a QR code there. So the student have to log in into the QR code.
That's good.
In terms of how to it's difficult, but I'm a little bit fortunate compared to Janet because my number of students is quite small. I have like around 20 students. Again, my problem is most of my students are Muslim. So they hide their face because they don't put up the mini telephone. Right? So I say, why you're there? Oh, okay, I put up my telephone. I said, okay, as long as you listen to me. And sometimes you feel very worried because the whole class is so quiet. Right? Talking to yourself, anybody respond to me. As usual, some students are very quiet, some students are more assertive. The same voice, you really hear the same voice, make you very uncomfortable. So I will like having classes with them, talk to them, then I will stop and they will have activity, group activity, will put offline so they have the activity, and then after maybe 10 or 20 minutes, I will come back again. Then they have to perform present their finding. So this is the thing to get them engaged. So it is very lonely to study at distance, right? So we need to really motivate them, not just coming into class. Yeah, sometimes you might post some message to social media, right? Just to build up the relationship with them, so to make sure they are not lonely. It can be very stressful, even though like we working from home. We are like alone, you know. What happened in your offices, like what you have been saying just now, so many weeks already you never to office, you miss your university, right? So it's different because you are learning on distance. You need some kind of motivation, right? A social relation with the student to motivate them. So this is as regard to attract the attention, but sometimes you have to take the benefit of doubt. Students are not listening to you. You don't get so upset. Like in the class face to face, you see students fall asleep. You get very angry, very annoyed. I didn't see you. I assume you are good. Then you are happy. You also get worked up. Then very difficult, right? So you should know your student very well. If you have been teaching them for a long time, so you have to pay more attention to those students are very inactive, right? So on and off, you should ask them questions. You should know your student so that they won't fall asleep. But you have too few students, it's difficult. After you ask one round of question, they
it's already finished
to come, right? So that for more students, for less students, then the turn come back to them very soon, and then they won't fall asleep. So this is the thing that we cannot avoid, right? So as regard to the clinical hour, right? So because this is like something emergency that we have to tackle online, not like a normal distance learning. You have more formulate calculation to count the learning hour. But here we have to compromise some things because this is just a short-term interventions, right? While waiting for the pandemic to go off. So we assume that live streaming is considered as face-to-face already. But of course, live streaming cannot go on for 2 hours. It is very, very tedious, right? The student will not stay on for 2 hours. So half an hour. And then we also consider like group work. Like I mentioned just now in my presentation, we use 365 Microsoft Teams, whereby the student can organize group work online, among them. So we consider the group work is also face-to-face learning among the students. Of course, we will be there, monitor them. So that is of course on theory. For clinical posting or for nursing skill, no compromise. You still have to, just like what Janet said, we cannot compromise. You still have to have hands-on in the clinical area. It's too bad, right?
Does it mean that maybe this is all for other speakers? Does it mean your study time is getting longer? I mean, like suppose they finish on, for example.
We make it according to our schedule. If let's say the class is 2 hours, then they have to do their work within 2 hours. The learning time is inclusive.
Okay.
each lecture, let's say every week I have two hours face-to-face, so that I make sure the 2 hour face-to-face for the student online. That means I'm doing synchronized, but not necessarily I'm teaching them for 2 hours.
Okay.
There will be activity for them. Then after a while, I'll come back again. They present the activity. Then I will have comment. So because the live streaming too long is actually taken up a lot of data from the student. They cannot afford.
Exactly. Yeah.
So
that's one of the strategies, like on off with the synchronized mode. Yeah.
So as regards to the how I cover my clinical hours, right? So the university have given us the flexibility to actually restructure our program structure, right? So I will move all the theory from the future semester, bring it to the current semester. So I will cover all the theory first, and then the practical will push backward.
Back in the back. Oh, okay. Move it. So we modify the time. Okay. So I'll let Cardi first to answer Rijal's questions.
Yeah, in terms of how to assess students' self-made video, I think it depends on what kind of clinical skills that you want to assess. So definitely you have to already have materials that the students have to learn, whether it's a theory in terms of how to perform certain clinical skills, and probably provide some videos to help them to show them how to do certain things. And then from there, then it will be just like, all right, now it's time for you to do it. And then this is the clinical skills that you have to do. But also it's important to consider whether it's feasible to do it. Like it's probably hard to find, you definitely cannot do urethral catheter insertion for that kind of stuff, right? Like there's certain clinical skills that you can ask students to make the video on. And so I think it's important early on to determine which of those clinical skills that can be done by videos. And then in terms of the one-page essays, that would be more of critical thinkings and, understanding the knowledge of certain cases, like, you combine pathophysiology, physiology, anatomy that you've already learned, and then you provide certain cases about certain diseases, and then, from there you would ask the students to, like, all right, this is your case, and what would be your clinical decision process? Like, how do you understand the case, and what comes to your mind, and what do you think you would do in the clinical scenarios? What action you would like to do? Because those are this is pretty similar in terms of when you take NCLEX exam in the US, like those are the type of questions that you're gonna get eventually, because the scenario will be framed in a clinical picture. And so students have to, imagine how it would look like, and, assuming that they have all the resources, the equipment in the hospital, what will you take first in those, what kind of equipment do you need to prepare, and then what would be the next steps, and how would you deal with reporting it to physicians, and how do you communicate the case with your coworkers? How do you deal with if you need more resources other than just yourself? And so those are the things that come into play in terms of how do you assess students' critical thinking in those kind of clinical scenarios. I would also add, just to emphasize, like in terms of clinical skill hours, the same thing happened in the US, that the Board of Registered Nursing still required like whatever clinical hours the student have to fulfill. So there's no other way around to deal with it. So I'm glad that Dr. Chan mentioned before, like you kind of like move stuff around, like what would be the next quarter subjects, then you can move it forward and do it this quarter, and then save the rest of the clinical rotations at the end of the second year, probably. And so, unfortunately, there's no negotiating opportunity there. And some programs allowed students to extend, because we're pretty fortunate. I mean, UCSF is specifically only for graduate programs, so we don't have an undergrad programs here. So it's more like nurse practitioner program and clinical nurse specialist. And so they have the opportunity to, a lot of hospitals still accept students to come and do the telehealth as well. And so some students do the screening process, like certain cases with, the COVID-19, they do initial screening, and they're the ones who refer to specialty cares. And so we are fortunate in that, but other aspects of clinical care that they cannot do while this pandemic is still happening, they unfortunately still have to carry it forward. I think it also depends on how each institution modify their policy in terms of registration issues, because UCSF allows students to continue their rotations like until the second week of the summer term, even though you're supposed to finish it in spring quarter without paying tuition fee, which is good. So students have extra 3 weeks to fulfill that clinical rotations. So I think it's important for the nursing schools and probably like other medical schools as well to maybe we can give some forgiveness in terms of allowing students to extend their rotations without paying tuition fees. I mean, it's really
that's the important thing, because I think that's the issues for the students. They are worried if they have to, in a delay thing, and then they have to pay for more tuition fee, which is this is not their fault actually. This is the condition. So maybe there's some consideration. For that.
I mean, and then the other option would be, unfortunately, some students have to take leave of absence for a while and then come back when things get better. So you don't have to pay tuition. But as you said, the study period would be much longer than what you already initially planned. So
So if I may, I will read another questions, but like from this discussion, that for this time we are trying to, instead of like just letting students staying at home doing nothing, we can improve their critical thinking skills at this moment, and maybe procedural skills as well. And then they will be ready when they go into the clinical practice. They're more ready because they are already been prepared with all the case scenarios and everything. So yeah, I think that's a very good strategies, I think.
Yeah.
So I will read some questions. This is from YouTube and also from our chat here. It is pretty much similar, so I will not read everything. So about the lab already, where is it? Okay, so this is how to, for students who the internet connection is not really good, like sometimes they, when we ask them to submit the assignment on time, and then, many of them say that, oh, I'm sorry, I cannot submit it on time because due to internet connection. So how do you manage this? Are you going to, like decrease is there any consideration for those who doesn't have or have limited access to the internet? And also, I think this has already been explained by Dr. Chong about using another platform with low bandwidth internet, like using Facebook or WhatsApp or another platform that doesn't really need a big bandwidth for the internet connection, like everybody will have Facebook. So Facebook, even in the like very remote area, they will access Facebook. Very good. So instead of using Zoom, we can use those kind of platform. But yeah, how do you make how do you treat these students? So just hold first. And there's another questions also related to student research. You know, like we know that many students, they're planning to have a research in a patient, for example, or in the community. They're going to have intervention, but they can't go into, or they cannot apply that. So how do you, in your school, Janet, Chong, Hawa, Kardi, your experience, and also Yani and Burini, your experience to modify the research method during this time condition? Please, whoever, maybe the one that haven't talked first, maybe Dr. Hawa and Yani first, and then we can move to other. Hawa, do you want to share your experience? Are you still there? Yeah.
Still there, joining your discussion. So your question is about how we handle our research with the students?
Yeah, because right now they cannot do intervention to students, or even they do interview to the participants. So are you doing some kind of modification?
For me, because I am the one who's teaching research course for this semesters, so handling everything with this issue. What we have done is, first step, we change the shift of our students' research aims and to be community-based. So whoever collecting data from hospitals, from schools, from whatever, they have changed their project to be targeted to the community. Secondly, all the students collected their data electronically, so no need to contact or to have access to any participant. Lastly, we try to reduce our requirement or to lower our requirements. So instead of requesting the student to have like large number or specific number of participants based on the power analysis, we did accept the students, whoever collected the data, just to run the analysis, and we accepted the descriptive analysis only if they couldn't manage to collect data to do the inferential analysis. So we managed to finish 26 projects, or almost 27 projects for our students with these modifications. The idea or the aim of the research course is to teach the students how to conduct the research. So we achieve our aim. Not the idea is to have like a large sample as they used to do it in previous semesters. So we stuck to this minimum requirement, and alhamdulillah, they finished their projects.
Okay. So how about the from UGM and UNHAS? Do you want to share your experience related to this research?
Yes. Maybe I would like to share about what we did in Faculty of Nursing. So, well, actually we have two types of thesis, bachelor's thesis and master's thesis. So for the students from the BSN program, so we are allowed them to conduct research as long as they obtain data using online surveys. And then they just use, for example, like phone call and whatever, and then they are not allowed to directly go to the hospital, even to the community. I'm sorry, because I mean, Makassar is the red zone some weeks ago, and then maybe still now. So, I mean, so that's what we did for the bachelor's thesis, and then also about the types of research. We tried to focus on the integrative literature review, just like Hawa said that we tried to allow them, okay, what you have now, but we ask them to focus on the integrative literature review. And then, meanwhile, for the master's degree, for the master's students, we decided by the Faculty of Nursing, by the Dean and all of us, so we have the rule that they can conduct 3 types of thesis. First is about the systematic reviews, and then the second one is scoping reviews, and then the last one is the integrated literature reviews. Why? Because that's the best options that we can conduct now, and then it's reduce their time, or it's not give them opportunity to go to the hospital, because it will make them delay to graduate. So those kinds of types of research that we try to do. And then regarding the internet connection, because this is always the problems in our university when we met our students like that. So actually, when we have our course syllabus well organized, well planned, they will not have any excuses saying that, I'm sorry, we delayed to submit. Because at the beginning of the semester, we've already mentioned, including the grade, the weight, the score, and everything, that we will evaluate you, these kind of assignments, and due date, what dates. I mean, it's clear there. So there is no excuse. I mean, so far we don't have any excuses about the internet connection and so on, because it's clear there. They can try to manage their times. There are some time that they can manage to get connection, unless it's really maybe far away from, I don't know, but we never experience these things. And then the most important thing about how to help and facilitate the students to get to stay focused, because that's also the question. And I would like to just share my experience. I taught for 150 students about biostatistics at 1 p.m. Can you imagine biostatistics at 1 p.m. using Zoom? So when I explain like that, I just try to use it, not teaching only, but make a break. After I teach something about the statistical test, I told them at the beginning, after I said, okay, please open your video now, switch on, and then I will see you to see you are there. Oh, you are there. Okay, so they are all beautiful and handsome. Okay, and then I screenshot as the proof that they attended the class. And then from the beginning, I told them that after the 15 minutes I told you about the statistical test, I will ask you one by one to show me again how to run this kind of test. Nobody say no, because they will need to stay focused. So it depends on us how we try to modify our teaching methods, because this is our class. So we try to control everything, but make them very comfortable. I don't think so they're comfortable anyway. So
they're scared.
That's just the way, I mean, to stay focused, because this is about knowledge. Yeah. So I mean, that's kind of a strategy, I think, that we can have them. And then regarding to move the subjects or the courses to the current situation, we couldn't do that, because once we enrolled, that's it. That's for the transcript. So we cannot move the semester, courses from the next semester to this semester. So we have to finish all this semester, but we still have we have some procedurals that we will pay to them, because this is our compulsory to give the students the clinical skills and everything. That's our promise. So telling the truth, what grades we launch this semester, because we finish HAWA also in Indonesia, in UNHAS, we finished the semester, we have also finished the exam, but the problem is because we couldn't achieve the clinical skills, and then either lab or in the hospital. So we promised them, when everything is getting better, we will give them at the end, but the current the current score is the optimal score that we could give to them, and then we hope them can show us the performance at the end of the, not at the end of the semester. We will see it, we will adjust the time, but we finish all the administrative things, because we live in the work with the administration things. So I think that's all from us.
We cannot break the rules.
We cannot break the rules. You're right. Yeah. Thank you so much.
Okay, so maybe from Ibu Yani, I have also questions for you, but you can answer about your situation about research method in UGM. Are you there? Or the connection? Her connection is not really good before. So
Hello.
Oh yeah. Okay.
Yeah, sorry, I changed with mobile phone. Based on experience of UGM about how, first maybe I would like to answer about how to motivate the student. So yeah, this is challenging when we do online lecture. So some lecturer give how to say, during their lecture to make a student awake, they make a quiz. They make a quiz middle of their lecture. So some use Kahoot, interactive quiz. So to make the student awake. And also about the research. Yeah, as I mentioned before, we have recommend the student to change the title of their research, the topic of their research, with use secondary data or literature review, especially for the student in the final year, because we don't want to make their pass delay. But the university have a policy that the student in the final year can extend 1 semester to finish their study. So for the research, we allow them to use secondary data and also literature review. But for the intervention study, it is challenging, because the community, not because the student, but also the community not allow the student come to the community. So maybe if the intervention such as give education, maybe we can participate into WhatsApp group and then educate them through WhatsApp group, and then pretest post-test using GPO, maybe feasible to continue the research in the community if the research using intervention study. Maybe that's Bu Rini.
Okay, thank you, Yani, for your answer. I think if I see here, all the questions are already been answered. I mean, like for I just kind of like summary all of the questions because they have a similar, like how do you achieve the learning outcome in your clinical, especially in the clinical practice. So they, if I can conclude that none of us doing the clinical placement at the moment, we all postpone it to wait until the situation is getting better in our country, that's what we hope, that we can pass all of these condition, and I don't know, new normal, they said new normal, but I'm not really sure about the new normal. But yeah, but what we can do right now for our students is to prepare them with the critical thinking skills, with the procedural skills, thinking skills, and to prepare them that, and also to make sure that you are going to go to the clinical placement later on. So you what do you call it? Don't feel lazy or santai-santai. Do not pay attention with your outcome later on. So yeah, because some of them maybe they go, because for us most of the students, I think majority of the students, they going back home to their kampung, their village. So some of them in Papua, some of them in the very remote area, and we cannot, that's why internet connection is a challenge as well with them. But yeah, let's hope this situation is over soon, and then we can come back to our beloved campus. Everybody will miss their students. And students also will miss us, I'm sure that. I don't know if it's correct or not. So yeah, I think I'm really sorry if I cannot read every questions, but I think like the link scenario that Sukardi has share is very useful, that maybe we can also take a look at that together. And perhaps I'm really hope that all of the speakers will, maybe if later on there's a questions that participants wants to ask, maybe through emails or through other platform, I would like to ask your kind permission to answer that, if you don't mind. So maybe later on we can try to find out how to answer all these questions. So this is the end of our sessions. Alhamdulillah, we already from 9, from 8:30 to 12:41. Wow, that's a very marathon. But it's a very interesting.
Can I say something?
Oh yeah, sure.
Yeah, I just want to say I think nursing institutions in Indonesia are doing great in terms of how they adapt to the pandemic, because I think, coming from Indonesia, it's always like, we always think that, oh, what people do in the United States, what people do in Australia, like they're doing better. And, it's really easy for us to feel discouraged that we don't have the technology, we don't have the engineers to help us create a platform. But I think like what Nurse Rini and from Ibu Haryani from UGM already showed us, like, you guys actually are doing great considering the limited resources that you have. So it's just a matter of how, the creative way, how to adapt, and what would be a most feasible way to reach out to students who do not have access. I mean, use whatever you have, I would say. That's the only thing I could say. I mean, it's not easy to adapt things from United States to Indonesia, and I think it's not easy as well to adapt things from Hong Kong to Indonesia. It's just that, just have the confidence and the courage, and also I would say keep reaching out to your students and see how they're doing in terms of dealing with the situation. So that's it.
All right, thank you, Kardi. Now, unfortunately, we don't really have time anymore. But
one last.
Oh, one last. Okay.
So just now, Dr. Sukardi have shared to us a lot of links on how to access all this video to facilitate in learning. Perhaps as an educator, we should guide the student on what is a reliable sources to view.
Oh, yeah.
See, there are a lot of video on nursing field, which is violating the aseptic technique and not following the proper procedure. So we will have to really guide the student so that they won't learn the wrong thing from the very beginning. Thank you very much.
Okay, yeah. So to find the appropriate one, the good resources for the students, not from we call here abal-abal. Okay, so I'm really sorry that I cannot answer all the questions, but I hope to all the participants enjoy the seminar and get more insights and take home lessons to each of our schools. And of course, we cannot, like Sukardi mentioned, that we cannot apply directly what Hong Kong's already did, or Australia or Malaysia, but we have our own culture, and we know our institution, so we can modify it according to our needs, as long as we know or we are sure that a learning outcome for the students is achieved. The method, we can modify it, we can use any kind of platform, it's up to you, but as long as it's for students good. At the end of this meeting, I would like again, thank you once more to all the speakers, Janet, Hawa, Burini, Buharyani, May, hope everything stay healthy in these conditions, and hopefully maybe next 2 years we can meet in person, like we make another seminar and We invited all of you.
And we are all healthy. That's the most important.
Yes, stay healthy.
Thank you for inviting us. Thank you.
Yes.
Thank you so much.
All right, thank you very much again. Thank you very much to all participants from all over the Indonesia areas.
Thank you all. Thank you all.
From Makassar, there are many from all
okay,
over.
there are many from UM. I'd like to announce here.
Oh yeah. And also Gulsar, are you still here? Gulsar from Australia, from Letron University. Yes, she's here. From 8 a.m. she's here. And still listening. I don't know if Gulsar, maybe she's not. Yeah, but
thank you to all participants.
All of the participants, thank you to the committee who's working very hard. We stay until 12 p.m. to sort it all of this. Sometimes our internet connection is not really good, but we try to do our best. We apologize.
You are doing very well today. Congratulations.
Thank you. We apologize for any inconvenience during this seminar. We try to implement it very
thank you for the moderator. Great moderator.
Thank you, Rini. And for the participants, we remind you to also fill again the form, and we will send the certificate, e-certificate to directly to your mail. Thank you. In this case, also in this occasion, I would like to send our gratitude to nursing associations and National Nursing Association Indonesia, who's already provide us with this platform because we only have 300 participants, but now we can expand it to more than 300 participants, which is very good. Thank you very much. And I close with wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh.
Thank you all.
Bye bye all.
Thank you.